open the Board of Commissioners meeting. Please join us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Citizen input. We did receive an email this morning for someone concerned about the positive numbers going up. We had 5, and we had 5 in the past, but we did have 6 yesterday. And I emailed back a response to the gentleman saying that we're now up testing approximately over 600 a week. And originally, when we started this, we were, we didn't have the testing capacity. So things are definitely, our numbers are going up, but the actual percentage of people infected is staying down. So please use your mask when you're appropriately, when you're in a building, and if you are vulnerable, please shop at appropriate times where the store is posted with those early morning hours for you if you need to go to the market. Yes, people are still very vulnerable, especially people over 60. So use really good hygiene, wash your hands a lot, wear gloves if you have access to them, but please follow all recommendations done by our public health department. And I'm sure they'll be talking about that in a few minutes when we open up.
So I just want to say something on that too. So Tom had sent out a media reports last night, and apparently the Bulletin was writing an article about this uptick, and I mentioned to him that we need to check about this presumptive tests. Are those being included? And I wrote back to the same gentleman saying, well, last week when we had 4 new cases, we were wondering about it, and we learned that 3 of the 4 were presumptive, which is a different standard. And so I don't know, if you've had a chance to get an answer, but that concerned me a lot because it's a whole different way of judging, having the case, so to speak.
Yeah, I believe Dr. Conway is intending to address that as part of the general update on the coronavirus this morning. In terms of the specifics, my understanding is that much of it had to do with some, they were identified through contact tracing, which is a positive thing, to kind of proactively, through a positive case, get out there and identify those that have been in contact. But in terms of the details, I believe that is going to be.
But will he know? My question is really, are they confirmed cases or presumptive cases? Because that's the big split.
Yeah, I don't want to speak for Dr. Conway. I know he's waiting, but I believe they are confirmed cases.
Okay. That's good. Because I notice on the OHA website now they're listing presumptive, but they aren't saying what county they're from. So,
Dr. Conway, we'll just, can you wait just a minute just so we get down to it? Just a second,
No,
please.
it's fine. It's fine. I was just going to say we can talk about that later.
Yes. Anyway, so we do have a consent agenda.
So I would move approval of the consent agenda items 1 through 5.
Is there a second?
Maybe interested in hearing about item number 2, Victims Assistance Program, just a little bit of discussion, if you're interested in pulling that for discussion. I see we have
Okay.
representation.
All right. Okay.
So I'll amend my motion, move approval of consent agenda items 1, 3, 4, and 5.
And I will second it.
Commissioner Henderson?
Just want to thank Greg Coleman for continuing to be a pro tem judge, and I vote yes.
Okay. Commissioner DeBonne?
Yes.
And the chair votes yes. So then our first action item will be then the extended limitation duration position in victims assistance. Thank you. Please.
Hello, Commissioners. Thank you. John Hummel, Deschutes County District Attorney. Spoke with you about this and the Budget Committee maybe, I think, 6 weeks ago. I gave you a heads up that we'd be talking about this during the Budget Committee hearings, which is a week from today. It's the question of when we get a grant for a victims advocate position, we have not had the match in our budget. So you'll have a full presentation on that a week from today, and you'll obviously make the decision then. So this is just getting us until the end of this year, basically 5 weeks. You'll decide tomorrow if we go beyond the 5 weeks. I mean, you'll decide in a week from today whether we go beyond the 5 weeks. So just getting us through the end of this fiscal year, and then we'll have the discussion next week about the funding shortfall that we have in this area.
So just kind of the logistics of how cases are evolving is kind of the only,
Yeah.
the discussion right now. So court has been slowed way down. They were trying to do some things. Courts are being remodeled at this point in time also. And so I know victims advocate are probably communicating with, and, dates are being extended, victims. So just some thoughts about that. What does the landscape look like right now?
Yeah, there's not less cases. When we, an officer makes an arrest or issues a citation, they send the report to us. We do everything we would have normally done. We review the report. We determine if there's sufficient evidence. We contact the victim. We advise them of their rights. We issue our charging decision, and then the court will tell us when that hearing is. Now, the court is pushing out a lot of those non-urgent hearings. If there's a murder, rape, robbery, they're holding those hearings, but the shopliftings and cases like that are being pushed out. So we're doing our intake, our processing, our charging, and we're still having court hearings every day. Just when we go to court and we might have 30 cases on the docket, now we go to court and there's maybe 10 cases on the docket. So it's not impacting the day-to-day. It will impact the day-to-day in a couple months when, it's coming, careful what you ask for, right? It's going to be a brutal end of the calendar year. But, we can do it. I don't want to speak for the judges. It's going to be, I imagine there's going to be some longer hours. I could see, kicking past 5 o'clock, though judges are the ones to decide that. But it's going to be a burden on court hearings when we get back. But the case processing is not much different at all.
Okay.
Yeah, just wanted to hear a little bit about it.
My question was, since we have the budget meeting next week, why aren't we just adding this next week if that's what our choice is to do?
Yeah, Commissioners, this is actually more of a procedural item. Ashley, I know, has done great work in lining up grant funding to cover us this fiscal year. So rather than leaving this position in limbo, we know that we have funding for it under the limited duration status to carry us through June. And as John said, we'll have a longer-term discussion next week. That's frankly why it's on the consent calendar, just to cover the short-term period.
Great. Well, with that, I'll move board signature of resolution number 2020-012, extended limited duration position in the Victims Assistance Program.
And I'll second that.
Okay, any further discussion? Commissioner DeBonne?
Yes.
Mr. Henderson?
Yes.
Yes, thank you for being
Thank you.
here today.
Thanks for joining us.
Nice to see you, Ashley. And thank you, John. Okay, we now need to reconvene as the governing body of Deschutes County 4-H Extension Service District. Eric?
Good morning, Commissioners. Eric Kropp, Deputy County Administrator. And are we doing Zoom yet, Whitney? Okay.
Not on?
No, it's not. Joining us via Zoom should be Nicole Strong.
I see you all.
Thank you.
We see you too.
There you are.
Nicole is the Central Regional Director for OSU Extension Services. For board consideration this morning is an IGA between Deschutes County and OSU. This just lines out the operating agreement between the two entities in terms of operating the service district. The Extension 4-H Service District was approved by Deschutes County voters in 1982. The Board of County Commissioners is the governing body and also approves the budget for the service district, and OSU operates the program, and also the employees work for OSU. The IGA is just an update. The current IGA expires at the end of this fiscal year. The proposed updated IGA goes through June of 2024. There are just minor changes to the IGA, updates signature lines, and it changes the term budget administrator to budget officer. Nicole, do you want to add anything?
No, it really just continues our strong partnership moving forward for the next 4 years. And yeah, very minor changes in there.
So, Nicole, we haven't seen you for a while. How's the new building working? And that sort of thing. Just,
Yeah.
it's off topic, but we don't get you in front of us very often.
10 minutes, so I'll give you a quick update. The new building is wonderful, and we're going to be using it next week. We're working in partnership with the Oregon Department of Agriculture and the National Guard to distribute face coverings and hand sanitizer for farm workers. And so we also have all of our high-speed hand washing materials in English and Spanish that we're going to print out and distribute with those supplies next week from the fairgrounds. So it is a wonderful building. We can't wait to get back in there. We are submitting our extension phase 1 proposal based on the county phase 1 proposal. So we'll be able to start having people coming back to work in staggered, socially distanced manners soon.
So has it been completely closed or just limited?
We have, our front office staff has been going in there to do critical functions, make sure everything's working well. And then we have 1 to 2 people in the building at a time, and that's all highly coordinated. And we're really focusing on critical functions. If you need to use the printer or your internet's bad at home or any of those things. So it hasn't been completely empty.
Thank you.
Well, great. So this has been a wonderful partnership, really providing that tax base to the organization that's running the programs. But I know the extension program and agriculture support, forestry, but also the 4-H and FFA staff. So it's been a great partnership, and I'm glad we can keep it going in this efficient fashion.
Me too. Commissioner DeBone, thank you for participating in the forestry interviews. We're hoping to get somebody started here at the beginning of the fiscal year.
You're welcome. Yeah, I got a little bit of feedback paperwork I need to do on that, but I'll get right to it.
Okay, good.
So with that, I'll move board signature of document 2020-308, the updated IGA with OSU.
I'll second that.
Any further discussion? Nicole, I just want to tell you how glad I'm here that the farm workers are going to be really critically helped. Maybe we don't have as many in Deschutes County, but I know in our outlying counties, there are a lot of farm workers, especially like in Wasco County. And so,
Yeah, our horticulture agent is just working tirelessly to support our migrant workers in Wasco and Hood River counties.
yes, I mean, it's so critical because you've seen what's happened in the processing plants, and that's been such a major impact for the entire country and our meat supply. So, I'm really happy to hear what you're doing today. So thank you so much, and I'm glad that you have a new job.
Thank you so much. I miss the trees sometimes, but this is great.
Okay, well, that's another issue. So therefore, Commissioner DeBone,
Yes.
Commissioner Henderson,
I vote yes.
and the chair votes yes. Thank you for joining us this morning in that excellent update.
Thank you. Have a good day.
You too. Thanks.
Thank you. Okay, so now we're going to have our COVID update, and I believe that, let's see, Dr. Conway, you had asked that Becky Johnson be on the call first. I see you, Becky.
Morning.
Good morning.
Commissioners, thanks for inviting me to talk a little bit this morning about the Trace COVID-19 project. This is a public health study that Oregon State University started in Benton County and in Corvallis to detect the prevalence of COVID-19 in a population. And as you know, most testing right now is done on symptomatic patients, but we know that people can have COVID-19 without any symptoms. And since they're not getting tested, we really don't know the actual prevalence of the disease in our community. So we are fortunate that OSU, having a branch campus here in Bend, is willing to extend their study to the city of Bend on May 30-31. They would come into our community and do about 500 to 600 randomized tests of households. They select these households randomly. They use census blocks, and then within those census blocks, randomly select households. And the person who's in charge of the household, plus any minor children in that household, can volunteer to be tested. And this allows us to get a statistically valid estimate of the prevalence of the disease here in our community. unfortunately, they only have enough funding right now. They got some additional funding from Pacific Source, so we're very grateful to Pacific Source for doing this. That will allow them to extend this year to Bend. But we can't spread those tests over multiple communities, or we wouldn't have enough tests in any given community to actually be able to reliably estimate the prevalence. So we're going to start in Bend, which is the most populous city within our community. So in collaboration with Deschutes County Public Health, the results will be shared with the people who get tested. They'll know if they are positive, and those positive tests, by law, as I understand it, will have to be forwarded to Deschutes County Public Health and the Oregon Health Authority. And it allows Deschutes County Public Health to follow up with any of those positive tests and make sure that we're doing the contact tracing for those. So with that, I'm going to turn it over to George to talk a little bit about the collaboration with Deschutes County Public Health.
Thank you so much, Becky, for joining us this morning.
Thanks, Dr. Johnson. I appreciate the summary. And I'll try to cover Deschutes County Health Services role. Before that, I don't know that it was mentioned, but OSU Cascades has stepped forward to provide very strong logistical training, et cetera, support, and including the collection of the samples and the volunteers and the whole cluster. So that this wouldn't be possible without Dr. Johnson and her colleagues stepping forward. So about our own role, our role will be to follow up on any positive tests. For our usual practice, this would consist of doing contact tracing and investigation and tracing. There's some benefits that will accrue to our county from doing this. One, it will rapidly increase our local COVID-19 testing rate. Two, it will test asymptomatic, that is, people that are not feeling well, persons, to see if they're infected persons in the community who might unknowingly be able to transmit infection to others. If new cases are detected, it'll give us an opportunity for further containment measures via contact investigation, tracing, and voluntary isolation. If the pilot is successful and community support uniformly positive, and if OSU can identify additional funding, as Dr. Johnson mentioned, this approach could be repeated every few weeks in Bend and potentially also applied in other Deschutes County communities. For example, Sisters from the Pond.
Dr. Conway, I just wanted to know, what were the results in Benton County? I saw a news clip on it where they were going, but what were the actual results of that test? Do you know?
I know those. If you want me to.
Yeah, I was just curious how, because you were walking up to people's doors and they were, in this time, I would think people might be a bit nervous about answering their door to a stranger.
So 80% of the households that were contacted agreed to participate in Benton County, and there were actually people that would see the van and the testers in the streets and say, please, come and test my household. But of course they couldn't do that because it has to be randomly selected households to be valid. But a very high response rate. The first weekend, they detected 2 in 1,000, 2 positive cases per 1,000. And the second weekend, it was one positive case per 1,000 of population.
Is that what they expected to find? Do you know?
I think George might be able to comment on this more, but I think given the number of cases from symptomatic people in Benton County, it was not a surprising result that they got so few positives. But George, do you want to comment on that?
Thank you.
Sure, and actually, as I mentioned in a separate note to Mr. Anderson, the biggest concern we would have, because these are relatively small samples, is that we might not see anything because of our imputed case rate being quite low now that we don't have hospitalization. We have had an uptick that we'll talk about in a number of cases very recently. And I was privy to those results, but I don't know that I'm at liberty to talk about it since I don't want to preempt anything that our Benton County colleagues would be talking about from their health department. So hopefully that has answered your question. And then can I mention 2 other potential benefits, or do we want to?
Sure, go ahead.
Do you prefer the questions? The other 2 benefits, and one of them is an innovative layer that we're hoping to add here in addition to what's been done in Benton, is that as you have heard, the Bend wastewater division has been serving as a pilot site for a startup company in the East. It's an MIT spinoff called BioBot, which had established its reputation for looking at opioid signals in wastewater, so sewage. And BioBot has been doing a pilot of that approach in a number of places around the country. And Bend was sort of a late addition to that, which is a very innovative work because it could give us an early signal for the presence of COVID higher than it's been in the last week or two, however often we do this. OSU and their engineering school and some of the veterinary science group there have been working also on doing testing sewage for signals, wastewater for signals for COVID. And they've been doing that in, I believe it's Washington County in collaboration with Clean Water Services. So we, in parallel, are arranging to duplicate some of the sampling frame for the household-based, Casper-based survey that OSU will do here for PCR testing of COVID with some layer of wastewater surveillance as well. And then also that OSU will do, the PI is named Dr. Tyler Radnicki. And then we'll be able to do some correlations, and we're also going to cross-test against BioBot so that we can migrate to this more local approach. So this is another way of expanding eyes to look at non-symptomatic persons with PCR testing, and then also early eyes on wastewater signals. And then I think the other benefit to this that I think Dr. Johnson's been quite modest about OSU Cascades' role is that this is a way for OSU Cascades to start establishing itself in the biomedical and public health spheres that I hope will lead to some further educational efforts and enterprise in that area. Thank you. We're happy to answer questions.
Actually, Dr. Conway, the second week of the BioBot testing, I noticed it said 0 on the report I read. The first week had like 600, the next week said 0, and I thought that was rather unusual. And then the following week, I think said 11 or 1,200. So I haven't seen it since those first 3 weeks. Where are the numbers at now? Do you know?
Once again, I am privy to the results, but it's been wastewater's the local site. I don't feel comfortable talking about those. I believe there will be some press coverage about that in the next actually 24 to 36 hours. What I will say is that it's important in science to do things more than once and compare notes. So initial finding of anything is just provisional, especially in sort of understanding the greater circumstance. So that's one of the reasons why I want to do cross-validation between the system that OSU is using and BioBot. And BioBot, Bend Wastewater has been a pilot, which has allowed for sort of a subsidized approach. That price will go very high, and we want to do quite a bit of sampling. So it's very kind of OSU to step forward to help with this approach as well. So we'll both be cross-validating some of the zero estimates which were based on basically either 0 specimens being positive or a testing problem. We don't know which. And then migrate to doing more frequent testing for more places as better eyes on the epidemic in conjunction with OSU and Bend Wastewater.
Okay, thank you.
So I want to follow up. Council Doyle, Dr. Conway is saying that he knows the results of the sewage testing, but he can't share them with us. Now, we're the county health authority. This happened a lot early on with this, and I'm wondering why can the press get it, but we can't get it? And I'm okay if we get it. I'm not asking you, Dr. Conway, quite right. I'm really looking at the legal issues, so I'm asking our legal counsel, because we went through this extensively the first month where we couldn't get information. And so I'm just wondering, what are the rules? This isn't HIPAA because it's wastewater. There can't be a single person identified. So any ideas on that?
If I may respond.
No, yeah, Dr. Conway, I'm asking our legal counsel. Thank you.
Certainly, Commissioner, to the extent that information's been publicly released, you indicated the media, that would be something you'd be certainly entitled to. And as the local public health authority, certainly offline, you could have that information communicated to you from your local public health administrator. There'd be nothing to bar that.
So after this meeting, we could ask for that information. We should be able to get that information. If our administrator knows it, we should be able to get it. Is that your legal
You can get it
understanding?
now if it's been released publicly. If it hasn't, then absolutely, yes. Offline, that would be well within the rights of the local public
Yeah.
health authority to ask of the local public health administrator.
It'd be nice to get it, we're making decisions. We shouldn't get everything from the press. And so, yeah, okay, thanks.
Thank you for that question, Commissioner. I want to make a distinction here. The reason that we don't talk about surveillance data that we gather through case reporting is because of concern about confidentiality. And I have followed a practice of that we do give confidential briefings.
Dr. Conway, we've gone back and forth for many commission meetings. We have a lot to do today. I'm not asking that. I asked a specific question like I did in the early things. That's all I wanted to know. I don't need to know any more about surveillance testing. I know what your rules are there. You've told us that many times. I just wanted to know about when we legally should be able to get this information about the wastewater. And you tend to talk a long time when we ask a simple question. We've got other matters to consider. There's other things on this that we want to ask about. So this isn't an open dialogue for however long it takes on this issue to me. If
Yes,
other commissioners want to hear about it, they can, but.
With Ben wastewater in this instance. Thank you. Are there other questions about the TRACE project that we might be able to answer?
So specifically about this OSU Trace project, is this a decision point for the Board of Commissioners? Is there authority to be delegated, or is this notification that it's happening in our community? My assumption is the citizens would be interested in the outcome of this. 500 or 600 individuals is a good sample to be able to make some inferences about the populated area of Bend. So what's the decision space? Is this just notification that it's going to happen? Or is this a yes or no?
I don't have the answer to that, George. Are we asking the commission for?
Well, it would be very good to have the commission support. The best way to proceed is there's a very limited MOU that it would be good to sign before going forward. So it would be very helpful to have the commissioner's stated support.
I thought your question was.
Well, no,
They're
that's
gonna
it,
go
just
public.
decision space.
Okay. So I thought his question was, would the results be made public and how soon after the testing?
Yes, the results would be made public, and that would be, so the study is being done by OSU. The public notifications about the overall study results would be made in concert with the county health department, but it would be OSU's lead, as with the statistical interpretation. We're providing a supporting role. That OSU Cascades is providing a supporting logistical role, but then we will also integrate any positive tests into our case management.
Yep, which should be standard practice anyways if you have a validated.
So what I heard is that, yes, the results will be made public. How long after May 30th and 31st would they come out, do you expect?
7 to 10 days post is the notification frame for the survey participants to receive the results. Public notification would be rapidly on the heels of that. And actually, just harken back to this other question, that is that the reason I didn't talk about the results is I was respecting Benton County and OSU's prerogative to describe the results in Benton County. So we will be able to comment and work in parallel with OSU as those results come out. I don't believe any of them will be released without or having an opportunity to vet and discuss them.
So you're talking about 7 to 10 days is what I heard you say from the dates the tests are made.
Yes. Now that's because it's a complex mechanism where the participants have an opportunity.
I'm fine with it. I just wanted to know the time.
But 7 to 10 days, I mean, it seems like if someone is tested, waiting 7 to 10 days is they could be out in the public if they are positive. That seems like an awful long time.
Actually, I was trying to clarify that. So positives will be notified as soon as the test is positive, which should be done within 48 hours. and the health department will be engaged as well as the primary care provider in follow-up as soon as there is a positive. So it's the routine notification that goes back 7 to 10 days later, and that's because of the throughput of the number of people and contacts, et cetera. But as far as positives and follow-up, I have had that clarified that we should hear, it should go into Orpheus, we should be notified, and the primary care provider should be able to be notified in parallel with that. And our expectation is within 48 hours. It could take a few more hours because of the transportation time from Bend to Corvallis.
Great. So is, I guess just the logistics, is this a new lab, new capacity at Oregon State University? Because I know the State Lab and University of Washington have been the PCR providers in the past and now commercial, but this is going to be OSU capacity?
Yes.
Pretty exciting.
Our College of Vet Med had some of this capacity, but did not have authority to do tests on humans. So they partnered with a different lab in Corvallis that had that authority. And so they're using the OSU Vet Med equipment and the authority to work test on humans of this other. So it's a public-private partnership that expanded the ability to do tests beyond what was already available.
Right. So it's new capacity. That's exciting
Yes.
to hear also.
Yes, and actually, it's also great that they're adding that capacity on the wastewater side as well. So we're going to be able to do a very innovative and potentially very insightful early surveillance.
So in general, I'm real excited about the project. I really appreciate Oregon State getting into this. I think it's great that the college is doing it there, and hopefully some of that will migrate here. So I appreciate that, Dr. Johnson. I do like we talked a couple weeks ago with BMC about would they ever be interested in a test like this, and they were. So it sounds like you're picking that up. The one thing in the memo that I just bring to your attention, because it has to do with how we look at it, I think, is there's a sentence in there that says this would test a randomized set of 500 to 600 asymptomatic individuals and get an idea of whether there is a hidden or silent epidemic brewing here. But just as important to us is that there isn't a silent epidemic brewing here. So I'm interested in knowing both sides of the equation. I'm not hoping for an epidemic or silent, and so that's really important. We get a lot of, even with what we've done in the closure, we're getting people that want to blame us for anybody that gets sick going forward, et cetera. So I think more information's good. It may be to some people, it looks like we have an uptick, like we mentioned earlier, because we're doing more testing. But that said, I think it's great to do the kind of a scientific approach to this. So I'm real supportive of it. Thank you.
Yeah, I am also.
Well, thanks very much, if I might add. So
Is there an MOU we're supposed to have in front of us?
the MOU for Mr. Doyle only requires my signature. You're certainly welcome to have it as well if you'd like us to add that.
Yeah, the MOU was prepared for Dr. George's signature, and he was directed to run it by you folks. This idea, if you want, it's a very simplistic IGA. I can provide it to you if that's something you want to see.
What?
I think we should see it.
I think it was.
We would like to see it.
I thought it was in with
So, no.
some material from Tom, but I could be mistaken.
We don't need to see it right now, but
No. So now?
Great. Thank you.
thank you.
Thanks very much. I'll just add that I think that piggybacking on some of the remarks made, that the findings in Corvallis are reassuring that there does not appear to be a raging epidemic there. So I think that this data will be useful in both of those directions. Thank you.
Right.
Thanks for your support.
Well, we do,
Thank you,
our biggest numbers,
Commissioners.
though, are those 29 and under of our positive cases in Deschutes County. And I just think that a lot of those younger people don't realize that they need to be very careful. So perhaps the random survey will work.
Thanks very much for joining us, Dr. Johnson.
Yes. Thank you, Dr. Johnson.
Yes.
Good luck with this.
Thanks.
What, next weekend? So,
Not Memorial Day weekend.
right, but the following weekend, yes.
Yeah.
Okay, good.
Thanks very much.
All right, so is Nahad now heading up.
Yes, I believe Mr. Zeddy's ready to present. It looks like his slides are already posted. Nahad, are you with us?
Good morning. Can you hear me?
Yes, we can.
Wonderful, wonderful. Do you see the slides as well?
Yeah, well, we see the first one.
Yes, exactly. Thank you. So my name is Nahad Sadra Azudi. I'm the Director of Public Health with Deschutes County Health Services. I have with me Dr. Richard Fawcett, our Health Officer, and Dr. Conway, our Administrator, is also online. If you allow me to just indulge in a couple of minutes of your time at the beginning to set the context, and then Dr. Fawcett will pick up with some of the local data. So this quote from Abraham Lincoln: "I'm a firm believer in the people. If given the truth, they can be depended upon to meet any national crisis," which is, by the way, what we're facing right now. The great point is to bring them the real facts. So let's start with some of the facts. It's been less than 6 months since we have gotten to know this virus and the disease that it causes. Just to put in perspective, that we've been struggling to learn about HIV/AIDS for more than 4 decades, and we still don't have a vaccine. So I think we have made a great progress in getting to know this virus and some of the treatment and vaccine options in such a short time. And of course, this is the sequence of events. One thing that I added is on May 15, parts of the economy have started to reopen. Globally, we are reaching nearly now 5 million cases with more than 300,000 deaths. In the US, we have passed the 1.5 million mark in terms of number of cases and more than 90,000 deaths. In terms of where we rank for cases and mortality, in terms of mortality rates, we're amongst top 11 or 12, just below Sweden and United Kingdom. And in terms of test rates, also we are amongst the top 10 or 11 countries. These are the most impacted countries, of course, and we are making progress in improving our testing rates. Nationally, we see that this virus is really affecting all populations, but now we're seeing more of it amongst 18 to 64-year-olds. So that's a big chunk of age category, of course. But as you can see, it's not sparing anyone. Everyone seems to be in danger. But those who are most affected when it comes to the tragedy of death are the 75 and older. In Oregon, as of last night, we have over 3,700 cases. That's 400 more than, around 400 more than last week, and a total of 140 deaths, which is 10 more than last week. And I know Commissioner Henderson was asking, so where does that rank us in the country? As you can see, both in terms of cases and number of deaths, we are at the bottom tier, which is a good thing of the others compared to other states. So at this point, I'm going to give the floor to Dr. Fawcett to share some of the local data.
Hi, good morning, Commissioners.
Good morning, Dr. Fawcett.
Thank you for inviting me. Over the past week, we had another 18 cases, as we talked about briefly last week. The OHA is now including presumptive cases in with the confirmed cases. That's part of the reason why we've had more cases over the past week. Despite that, we are doing a lot more testing as well. We had actually, as of last night, over the past week, 983 tests done in Deschutes County. So that is quite a bit more than the week before, a lot more than 2 weeks ago. So on this slide here, it's 107 cases as of last night, and of those, 81 have recovered. And then the negative tests were almost 3,800, 3,799. There was one new hospitalized patient, but this was a patient who had been in the hospital before. So I think the number is the same in terms of total patients in the hospital. We don't have any patients in the hospital. That patient's since been discharged and actually was doing very well. Next slide. And then looking again, the age breakdown, we are seeing this highest prevalence in the 20 to 29-year-old age range, which was different than back in March and the first part of April, as we've discussed before. Next slide. The breakdown in terms of male-female is almost equal, slightly more women diagnosed than men. And we're also seeing most of the cases here the past week or two, there's really no associated travel history. And again, that was different back in March and the first part of April. And just a quick update on the metrics in terms of having to go backwards in the phased reopening. We're still, I think, doing very well with contact tracing within 24 hours. So of all cases, we've had more contacts, more potential exposures recently because of families congregating, et cetera. Fortunately, most of these new cases are doing very well, non-hospitalized, as I mentioned. And let's see, so there is going to be a new regulation with OHA here where they'll be getting data regarding each county's percent of contacts that were contacted within 24 hours. So we're going to be reporting this to OHA. I don't see any problem with this for our county. We have a lot more contacts compared to 2-3 weeks ago, but they're all being reached, and so I think that's not going to be a problem. In terms of testing, this number here was as of Monday. We're about 7th statewide for numbers of tests. So it's when the 21st statewide for overall testing per 100,000 population. So not as good as, yes, huh?
I have a question. You just said that we had 3,799 tests, and yet that says we have 3,835.
I think
Monday versus last night.
Right.
Monday.
No, I understand. Yeah, the Monday number. Let me look at that here. Right. I think that the 3835 is actually as of last night, and the 3799 is Monday. I apologize for that.
Okay, I just was wondering
Okay.
if there were like numbers that went somewhere that didn't get counted or something. Okay, thank
No,
you.
that's true.
It's interesting, Dr. Fawcett, it's interesting that there were still 21st statewide. That's when we first complained about it. It was about 4 weeks ago, and we were
16th.
16th. Yeah, so we actually got worse before. It looks like now we'll get better, hopefully, and that's great. But it's interesting that it took that long to pick up. But
Right. Yeah. No, it does. I think it is getting better. It looks
Actually,
like
this tells a better story.
Yeah, the last point, the 11th statewide is looking over the week between the 12th and the 18th. So yeah. Right. So hopefully we're gaining on that 21st to 11th, but still at 21st overall. For the next slide, this is the numbers tested as of Monday. Well, actually, the week range is 510 to 516. So that last data point shows up to 866. So the numbers of tests are increasing, and again, making sure we have the right time frame. The dates are a little bit off, but 512 to 518 are 11 statewide. And that data that I'm showing in this graph here is it's hard to see the dates there on the bottom, but the 10th to the 16th So in any case, we are going the right direction, but still farther behind where we would like to be, I think.
I think part of the issue is that our team updates certain information during certain days of the week. So this particular graph is because every Friday we update it. We just don't have the capacity to do everyday updates, and nor does it make sense. Whereas other data are coming in at different times. So there'll be some small differences sometimes between the numbers, but rest assured the trend shows that when it comes to testing, we are definitely improving. And will improve even more, especially with Trace coming on board. Okay, let's go to this one,
sure.
Please. Also a new dashboard.
Yeah, another new dashboard being developed by OHA. And it's going to be released here tomorrow.
This is as of yesterday.
So this is just the case breakdown by day. Nahad, do you want to comment on that more?
Yeah, so this is the daily breakdown of our numbers. I think a couple of points here. One is that since May 1st, we are including confirmed and presumptive cases, which is happening statewide with all counties. So we're all in the same boat, and we're all going to be measured accordingly. So I don't think there is any worry in terms of whether our numbers are going to jump up or not, because everyone's in the same boat.
So, Nahad, we heard about this the first time last week at a meeting, but you're saying they've been counting presumptives in the tallies all the way back to May 1st, which is two full weeks before that?
Yeah, I think what happened, Commissioner, is that they announced it last week, and then they went retro and looked at beginning of May data to correct some of the figures. Dr.
Well, that's fine, but it does change the standards, which we talked about last week at our meeting at length. And, nobody knows this. I was talking to one of our one of the county's elected officials this morning, and he was shocked to hear that. And so that does change it, and that needs to be out in the press. I mean, last week we learned we're going to do it. This week we're learning we're going to go all the way back to May 1st. So it changes the way we look at the whole chart. But to the uneducated that's used to the old concept from the last 2 months, it just looks like there's more cases. So hence we get the email this morning, hey, there's cases are up. What are you guys doing? I hope you can, do whatever. And so this really needs to be publicized, big letters everywhere. Case testing standards changed, may result in higher tests, don't overreact, or something like that. I mean, that's my 2 bits. I don't know what the other commissioners
Well, the fact that we did 866 tests, I had no idea that we'd gone up that high. And we did have 3 fives before the 5 we just had, but then we had the first 6. So, we did have 5s before, but how many hundreds more tests are we doing now?
Well, 3 or 4 times more tests.
Right.
So you would expect what's now a 5 might have been a 1 or a 2 previously. Do you think that's good way to look at this, Dr. Fawcett or whoever?
Yeah, I comment on this, please. So there are 2 separate issues here that I think we do need to acknowledge. One is it's a very good question about presumed testing and presumed positives. We did actually ask, and virtually all the health officers and health administrators asked for OHA to track them separately and publish them as such, and that we would do the same. But it turns out it's quite arduous because it involves a reconstruction using Orpheus. So that's one issue. Now, it turns out that a very high percentage of the presumed cases do end up being tested positive. So there's actually very little additional numbers, but the timing of the report may vary. The second issue is that that we may detect additional positives as we expand testing. And that is true. It's a separate issue. However, I think that Mr. Azzotti is going to talk about that based on our investigations, we do believe that there's a substantial reason for concern about this recent increase, and that it does not appear to be wholly attributable to increased testing. Over.
Yeah, Yeah. So, I mean, obviously, I think this group, all of us understand that more testing doesn't mean more cases, right? Basically, we have the cases in the community, and testing basically identifies them. So we're gonna, and the whole point is to identify them and take them out of circulation so that others are not affected. And then ultimately, commissioners, I think the main indicator that all of us need to be watchful of is the hospitalization rate. I don't think the new cases necessarily will tell the whole story, and presumptive or confirmed, as important as the distinction is, as you rightfully said, I don't think it will necessarily be the tipping point for us. As soon as we see the hospitalization capacity decrease and ICU capacity decrease, I think that's where we need to draw the line and have further discussions and actions.
You mean
So
increase? Because there's no way.
let's maybe go to the next one. And here's basically the cumulative cases, which.
Yeah, we both have a question on your last statement.
Nahad, didn't you mean?
Yes, please go ahead. Go ahead.
Didn't you mean to say hospitalizations and ICU increase? You said decrease, because right now they are at 0. So did you mean to say increase?
Yeah, maybe I said it fast. It was the capacity of our hospital system. If it decreases, meaning that the number of beds in use are increasing and they don't have as many beds available, or ICU beds available, or ventilators available, or the healthcare staff, they're getting sick or they're not available. So if that capacity is decreasing, then that's when we need to be worried, because we don't want to reach a point where we have to decide between who gets a ventilator and who doesn't. So that's what I was referring to, commissioners.
So I have a follow-up, but I haven't heard this asked yet, but it's occurred to me for a couple of weeks. The biggest issue is not really the confirmed, or it seems like to me, is not really that it's confirmed cases or presumptive cases. It is how many end up hospitalized, because those are the most serious, it seems like. And if you look at just the data, we had a lot of hospitalizations in early or late April, maybe it was late March, early April. So that's like 5 weeks ago. And so even though we keep getting more cases, the hospitalizations have never gone up like to those levels. I mean, there were 12 and 14 people in there. And so if you were just looking at it, it looks like if this was a storm, the storm's kind of come and we're at the tail end of it. So what is the thought about this lack of hospitalizations over the last couple of weeks compared to that period in March and early April? And I'm not asking for the definitive last scientific thing, but just impressions as health professionals.
So the first, we've had 3, if you will, waves. The first wave, so the demography and the risk factors have been different. The first wave was people that were returning from travel. Some had been on cruise ships, some were returning from high endemic areas such as northern Italy or U.S. cities. The second wave, and those folks often were middle-aged or older, which predisposed them to more complications, which could result in hospitalization. And they also may have been exposed to a much higher infectious dose. The second wave were spouses, domestic partners, and household members of those initial cases. And they also may have been exposed to very high dose, and also their demography was older. The cases that we've seen more recently have centered more toward young adults in this third wave. Young adults tend to have more contacts. They may live in more crowded housing, so there may be more contacts that way as well. But the likelihood that a young adult will be hospitalized, especially if they do not have any severe underlying immune or metabolic disorders, is very low. So the change has been largely because of both the level of exposure that led to the cases, and then the demography has shifted very much to younger people.
Well, that would be a great summary, Dr. Conway, and that would be a great article for the paper or the bulletin or whatever news, because that's the first time I've ever heard that explained in that concise way. That's great. Thank you.
Okay. Thank you, Dr. Conway. Okay, so I give the floor back to Dr. Fawcett. You wanted to add something about this?
I also want to just echo what Dr. Conway mentioned, that, we are doing more testing, and so we're finding positive tests in less symptomatic, sometimes even asymptomatic individuals. And I think part of the reason for the sort of lower inoculum dose is the social distancing. So it's a great point that luckily, fortunately, most of our new cases now are not as ill, not being hospitalized. So we still are at zero hospitalization. I'm sorry, zero deaths, and we don't have any confirmed, and I believe also no suspect cases in residents of long-term care facilities, which is terrific. We do have now a total of 5 cases, I believe, 5 or 6. I think it's 5 confirmed cases in healthcare workers. So we're watching that pretty carefully. And of course, part of the importance of contact investigation and tracing when we're dealing with positive healthcare workers is to interrupt transmission very quickly in that setting. So go ahead.
So,
Yeah.
Dr. Foster,
Yeah, go ahead.
do we know, are workers in the long-term care facilities now being tested on any kind of basis?
Good question.
On a regular basis?
Right.
Good question.
It's something that I think that the state wants to do. I don't think we have that program up and running. We have done some tests in workers in long-term care facilities who are asymptomatic, even if we think they were not exposed to the individuals that were found to be positive. So that's something that we should be doing more, and I think we're going to see more of that coming up.
Yeah, great question, Commissioner.
No, I would hope that would really be implemented as soon as possible.
So in short, we're not doing routine systematic testing of these essential workers who are every day putting themselves in danger, and perhaps others too. So it's a good point.
We're
and
working
it's
with the most vulnerable in our county.
Absolutely. Absolutely. No, it's a good question. And I think the good news that Dr. Fawcett mentioned in terms of zero deaths really, again, are more pronounced when we look at the earlier models that show that if we didn't act, what could happen in terms of the deaths and the hospitalization rates and the cases in our communities.
Well, to follow up on what Commissioner Adair is saying, I mean, I know when Summit BMC was here, we kind of talked about this idea of expanding the testing, and I asked specifically, well, could a business come in and get all of their employees tested? Why couldn't we as a county ask an entity, it could be like OSU, who's doing it for scientific or, bigger deals, to test our long-term care facilities, because businesses, what we learned, and I've seen it on TV, that businesses can hire testing facilities to do all of their employees. Why wouldn't we make an effort of that? I know that it's good that the state wants to, but the state's a big place. What if we wanted to do that and start a testing program like that would protect our people in those facilities?
I'm glad you're asking these questions. It's just I'm very passionate about this issue, and not just long-term care facilities, Commissioner. Like the daycare workers, the teachers, the healthcare workers, our police, our firemen. During a time when we asked everyone to stay home, then we reached out to the essential workers and asked them to actually leave their homes and go to work. And we owe it to them, and we should, not only for their protection, but also to ensure that they're not transmitting to others, to put in routine systematic testing. And I don't think it's a technical issue as it is a logistical issue, Commissioner. That's my take on it. I think it's a matter of, do we have enough tests in the community? Who's going to do it? How much will it cost? Who's going to fund it? It's really thinking about those details and having your voice behind it. That's going to, I think, help our community move in that direction, and in fact ensure that we contain this virus as much as possible. So I suggest we continue having this conversation, and perhaps offline it with a task force and take a look at it more deeply. Is that okay?
If I may add, Nahad. So Nahad, maybe being overly modest. So late last week, we agreed that we would start developing a routine testing policy for enterprises, particularly the ones you mentioned, long-term care facility and daycare centers, et cetera. And he's involved two of our senior nurses to help develop such a policy. And we're hoping to float that in the next few days and find out which of our clinical partners may be willing to take that on themselves. Failing that, then the model that Commissioner Henderson, you suggested of other contractors, commercial enterprises, be engaged to do that directly for those organizations. Thank you.
I mean, we have
We'll be
three of the
we're back.
long-term facilities, and I, you know, those to me are the most vulnerable per, you know, mortality in our country. So sooner we can implement that, Nahad, that would be important for those people.
I would agree with that.
Commissioner Dare, I wanted to also just quickly just look at the number again. I really apologize for getting those numbers backwards. But I did want to clarify back when we were talking about the total tally as of yesterday, the 3,799, that was the number of negative tests.
Okay.
That's where I was confused. So I think the slide was correct. I may have misspoke. The total tests as of last night for Deschutes County was 3,906. And so then as of the day before Monday night, that's where that total of 3,835 comes in. So again, I think the confusion I made was getting the negatives mixed up with the total tests. But one thing I wanted to emphasize was that for the past week, the positive case rate is 1.83%. So despite the many new cases that we have, which include presumptive cases, our positive case rate is actually stable, if not a little bit lower. So that's good news.
Isn't that really actually excellent news?
Yeah, no, I think so.
Staying down under 2, and it's being consistent. Actually,
Does that have tested? 1.83% of tested or positive?
Yeah, that number is just looking at the numerator is all of the positive tests, which includes presumptive tests over the past week, divided by the number of total tests for the past week.
Right.
If you look at the total incidence rate to date, as of last night, it's 2.74%.
so
It's stable as well.
Dr. Fawcett, I actually received the postcard saying that I'm one of the 100,000 in the state that should be tested. Have you talked to anyone else that has received that postcard? Because I haven't found anybody else.
I
feel
haven't.
very lucky.
That's great.
Commissioner, you should buy a lottery ticket because
Oh,
none of us have received. You have good luck.
No,
But
so
Commissioner, you are indeed lucky. I hope you've responded.
well, no. Then they're sending me an invitation. This was a big card
Great.
with a picture of Smith Rock on it. And then they're going to send me more information, which I have not received to date. So anyway,
Good.
yes.
So going back to the earlier models and what we did, I mean, I could go through all the details, but bottom line, to summarize it, we acted promptly and sacrificed for the greater good. And that's all of us, the leadership, the community, essential workers, everyone. And as mentioned last week, the latest models show that we may have averted 70,000 infections and over 1,500 hospitalizations in our state. Some of the latest developments and considerations, unfortunately, we were thinking that, well, not unfortunately, earlier we were thinking that children are spared from this virus or the severity of the disease is not as much on them. But unfortunately, we're learning that that may not be the case with some of the latest developments, as you may have heard in the media. I don't know if Dr. Fawcett or Dr. Conway, you want to add anything to this? Or we move on?
I think we can move on. There was one case, I believe it was confirmed in the Portland area of this multi-system inflammatory syndrome in a pediatric patient. But I haven't heard the updates on that.
Okay.
So this is
Next.
Commissioner DeBone, the bullet point number 3, routine testing for essential workers in vulnerable settings. So that's the topic that we just crossed a few moments ago.
Exactly.
So, yeah, I mean, I would be supportive of, making sure that comes back as a very specific item for our Central Oregon long-term care facilities and just the testing capacity. I think Dr. Conway mentioned that looking for a provider to take that on. So, I just show support for that also. It's a good task to be focused on.
Great, thanks very much. We appreciate that support. As far as children goes, the other thing to remember about children is, while there is the dreaded syndrome that's been described with at least one case in Oregon, the other thing to bear in mind is not only are they not spared of potentially becoming quite ill, but as far as anyone knows, children can be carriers. So when children are infected, even if they do not become ill themselves, the same as teenagers and young adults, they may not become ill themselves, but they may well transmit to others.
Right. Yes, which goes to my earlier point that daycare centers, for example, summer camps, schools, we need to institute similar strategy in those settings as well for that precise reason. Just a couple of issues that are on the horizon, being tested in various levels in different states and different localities, is how to, without compromising our privacy, of course, which is very important to me personally, but how to leverage the technology and the applications available to complement and enhance our tracing. So there is some conversation in that regard, and I again, without compromising any individual privacy and what have you, I'd like for our county to explore those options. And then, of course, as Commissioner Adair and others have mentioned over and over, the unintended consequences of the crisis we're facing is around social despair, and that could be around substance abuse use and other important issues, which we have to continue to pay attention to. In our county here, my colleagues, Janice and her team, are really on top of that. But as a community, we need to pay more attention to these issues. So very quickly, some of the takeaway messages, perhaps for our community than anything else. My wife and a number of people often ask me, what's going to happen now with the reopening? What's going to happen with this virus? And my answer is the same to her and to others, is that you tell me how you're going to behave, and I'll tell you what's going to happen with this virus a couple of weeks from now. If we're going to go to a Mother's Day gathering, if we're going to have the 4th of July event, and we're not going to practice social distance or physical distance, we're not going to put our masks on, we're not going to practice hygiene as we should, then I'll be pretty confident on what's going to happen with this virus and the transmission in our community. So we need to continue to learn to coexist with this virus for a while, find a new norm basically in our daily lives. We need to continue to do in the absence of vaccines and drugs, we need to continue to do the basics, which is wash our hands frequently, wear masks, practice physical distance, but we need to continue to engage. Practice physical distance, but we need to connect, and practice physical distance, but go outdoors. So these are not contradictions, right? We can engage in our community through social media and other platforms that exist. We can connect, Zoom and other applications exist, and we can still go outdoors, walk, enjoy the beautiful scenery in our community. But at the same time, we need to practice physical distance. Last couple of points. If our community has had any delayed health services, including vaccination, preventive care, what have you, now is the time to reach out, make appointments, and see your primary care provider. As mentioned, around social despair, we need to continue to pay attention to our mental health. And one study I just recently read is that 25 to 30% of the videos on this topic, COVID-19, on YouTube are basically vehicles for spreading misinformation and rumors. So as a community, we really need to pay attention to the sources of information. There are many sources out there. A lot of them are not necessarily, they have their own agenda and they're not sharing evidence-based information. So as a community, we need to pay attention to that. So many thanks, especially to Jenny, Faith, and Jill, and Eric and Tom. Eric and Tom actually provided me some slides for the reopening, but I didn't think we'd have time, so I didn't share them this time. Perhaps I can share them next time. But also many thanks to colleagues Jenny and Jill for providing the data, and to Dr. Fawcett and Dr. Conway. Over to you, Commissioners.
Thank you very much, Nahad. And thank you, Dr. Fawcett, too, for your excellent update on where we're at and what we're going to do for our first responders and our healthcare workers for the vulnerable. So, yes, please carry on.
Will do.
So, then we have our CARES Act distribution.
Greg's teed up for that. I'm not sure if he's planning on coming down or if he's going to do that remotely. He is on Zoom, looks like.
Okay. Are you on Zoom, Greg? There he is.
Good morning, Commissioners.
Good morning, Greg.
Here we go. So I have James here with me, and two of us are going to tag team this. I thought I would just give you a quick high-level overview of the CARES Act and where we are in terms of funding for that and what we've been doing over the last couple of months. And then James will take it away and give you the details. He's been doing lion's share of the legwork with this, and so he has all sorts of details that may be of interest to you. So just sort of a couple of comments. I want to say that since this all came down back in March, we have been working through the EOC and with our county departments on making sure we're diligent in the ways that we're collecting costs associated with the COVID-19 pandemic. And to the extent possible, we've been doing that through the general ledger so that we actually have a tracking mechanism. We keep track in our accounting system that's auditable for the future. So we've been real diligent on that. About the same time, James and I were both appointed as finance chiefs for the EOC. So we've both been engaged on what's going on a day-to-day, and now it's on a every other day basis. But one of the other sides of that is James has done a really good job of collecting all potential grant and other funding sources that would offset these costs. So there's several of them out there. He'll probably briefly touch on those, even though we wanted to hone down in on the CARES Act and the funding available through the Coronavirus Relief Fund. So I'll just say that there's more to it than just that. So generally, I'll just say that, and you know these numbers, there was $1.6 billion that was made available to the state of Oregon through the CRF. And what we're talking about today and what's due on Friday is boiled down to a pool of $50 million that was released by the state and made available for us to apply. That is the general overview. If you have any questions for me, I can take those now, or I can turn it over to James to get into the details.
Greg, I have a question for you. Has the governor's number been released, the budget shortage? It was coming out this morning. I saw a letter that she was requesting funds from Washington, and I just wondered, have you seen that?
I did. I was on the entire webcast for that for the forecast revenue finance update, and what I will do is I will forward that information out to everybody once I get something that's a little more consolidated right now.
Okay, so you can't give us a number though, like 3.1 billion or the shortfall? Did she?
No, I don't have that, but the one number that might be of interest to you is they said on the forecast is that we were looking for for us to get back to basically the economic position that we are now. They're projecting somewhere between 4 and 5 years. They used the term, this is odd, I had to listen to it a couple times because I think I used this a couple of weeks ago and I hadn't heard it again until I heard this morning on the state, but a square root recovery line. So not a W, not a U, not a V, but a square root recovery line. So yeah, as soon as I get some more information on that, I'll push that out to everybody.
So I'm shocked if she didn't specifically say this is where our shortfall is estimated. I mean, that's what everybody that we've talked to about it has been waiting for, is kind of the number. And so that wasn't indicated at the press release today?
This was not the governor speaking. This was the state economists that were actually running the presentation.
And they didn't mention a number?
They shared some graphs, which I can share with you, but I don't have a number off the top of my head.
It's just been a subject of many of our meetings with our legislators and things, because that will prompt what the cuts will want to be by the state, which will prompt what we might not get. So interesting. I'm just, yeah, that'd be great if you could forward it. I'm just kind of surprised. I was Googling it here to see if I could find something specific, but.
Yeah, again, this was just talking about the revenue forecast and their projected change in what the revenues are projected to be based on the pandemic. So there's no conversation about budget cuts.
No, I'm not. Yeah.
On the
Shortfall.
Yeah, no, I'm saying it's the revenue shortfall is what we've been all waiting with bated breath for a couple of weeks or a month. It's been talked about multiple times and lots of phone calls. So that's interesting that they didn't say it.
Yeah, I'll get back to you with a summary as soon as I have it.
Okay, thank you.
So a question on the CARES Act funding. This is an application by Deschutes County Emergency Operations. EOC has been a tri-county effort. Are there other applications being put together from Central Oregon?
I'm going to turn that over to Mr. Wood here, who can probably answer that question better than I.
Okay, can you hear me, Greg?
I can hear you.
Okay, great. So good question, Commissioner DeBone. Our number one goal with all this, at least from the financial standpoint, since we're kind of an arm of the EOC, the Emergency Operations Center, is to be made whole, to be made whole financially speaking. And so that's our objective, is to collect all the costs as they're coming in, whether they're coming in from the EOC, from the FEMLA change in payroll requirements. That was the extension of the 2 weeks to 12 weeks of paid time off, or any other department costs or materials and services that happened outside of the EOC that was in support of the COVID-19. They could include individuals moving from position to position to better assist with the response. So our job's been to collect all of that. And how we did all this was we created some time tracking mechanisms within the payroll system and in the general ledger system, as Greg had mentioned, and we've been collecting those since March. And with all that data, the first strike we get to take at it is going to be with this CARES Act. And the CARES Act, all the guidance is attached. This is from the third bill that the federal government pushed out, where it pushed the relief funds of $150 billion down to all the local governments, and then including the states, and then $400 million was made by Governor Kate Brown, and then $200 million is for specific for the time period of March 1st through May 15th. And this is kind of the money that we're starting to draw on. So to summarize, we're aware of all the costs. We've been tracking them. And now we're starting to pick through those, and we're going to request reimbursement for as much as we can. But because there are so many other different funding sources that have been popping up. So for instance, House bill, the very first House bill that came out with COVID-19 was for some federal funding. And then that's had kind of a trickle down effect to the states. And then we've been seeing some dollars come in through health services. And so we need to coordinate with those and make sure that we're not, missing out on any funds or not being reimbursed on some eligible expenses that were due. So there is this coordination effort that's going on. Just to kind of give you a rundown of the grants that we're aware of. Of course, there's the CARES reimbursement one, and we didn't know if we were going to be involved with that until the middle of last week. So we've kind of had a race to pick up all the little costs that are out in the departments that weren't part of the EOC. But that one's coming back, and that's the preliminary number we have included in the packet. It's around $800,000. But after that, if there's anything that's not paid for with that, then we have the OHA dollars that they've funneled into health services. That's about $250,000. COHC has given us a $5,000 grant for telehealth services. The DOJ, we're working on 2 applications, and I think it's the next item with Sergeant Nathan Garibay, but the application for that, and they're looking to spend those dollars on some additional PPE. So,
James, it's, it sounds like you're trying to explain that there are lots of different sources for money, but I think from our perspective, we're aware of the 1.6 billion, and most of us for local entities. And just as an example, Washington County is getting $100 million of this same money. So our effort to be precise is, they're about 2.5 times the size of us. But there's a kind of an argument going on between county commissioners throughout the state about us having this strings attached money, which is not what Washington County does. So I'm glad you have other sources, but this is not overly aggressive in asking for 800,000. It's so I just want you to know how we perceive it, because we've talked about this a lot, and we're talking about it with other county commissioners about why we are treated so differently than the other
The metropolitan area.
And we've had a real clarification from our congressman who's wrote a letter to the governor saying it's intended for broader things than her. This is the worksheet they created. But anyway, I just want to point that out. And I'd like to go through the items specifically.
So real quick, at a high level, the question is, are there other applications coming from Central Oregon, as in our cities or special districts, or is this the only application coming from Central Oregon? Do we know that?
There are other applications. I've worked with the city of Bend recently to discuss what the types of costs that they're including versus what we're doing. Anything that they paid for, they're going to get reimbursed for, and any of the local governments in the region can apply for this. I know that the City of Sisters reached out to Eric Kropp, and we've relayed some of our information on how we're interpreting the guidance that's coming down from the state. But one thing to mention about the dollars that the larger counties are getting is that they're still held to the same requirements that we're held to. Within this packet, there's going to be...
No, they aren't.
Governor.
They aren't.
Well,
they're able to use it for instance, for business. That's the big controversy. They're able to distribute some of that money to businesses. So they have it's a big issue among AOC right now because of how many counties are on our side of it, and so
33 counties are seriously being impacted by it.
Yeah. Yes, and we have noticed that in the guidance, and I guess just from the perspective of what we're allowed to apply for, this is what we've come up with. The state did get the $1.6 billion, and they then funneled it down further to what they're allowing us to apply for. But even if they had not done that, we would still be in the same boat as Washington County in terms of what's eligible, what's not, and then having to support those costs with eligible expenses, and then having to remit back anything to the Treasury if it wasn't spent properly. So I agree, and I see the difference between the double standard, if you will, between the two different entities. But at the end of the day, there's still going to have to be justified expenses.
So, James, I have a little question. I know we have 300 COVID tests, I believe our health department had. Were those given to us for free? They're not listed here, and I just wondered, okay, was that a free? The testing itself is listed, which we haven't done, but were the tests, did we have to pay for those tests?
I'll have to check in with, I can get back to you on that, Commissioner.
And then my other question is FEMA funding. Have you tried to push everything here and not to FEMA because it's only 75% they reimburse and it takes like 3 years?
You got it. So this is our first crack at with the bat. If anything that gets past this, then we're still going to be tracking everything for FEMA reimbursement. Going back to our original goal is to be made whole in terms of cash outlay.
But I think what we're saying is swing the bat as hard as you can, because this is the best source of funding for us. Other things are maybe more competitive. We may be limited to only 75% of the money. whatever. So this is really just when you said well, the governors, the state has whittled it down. They didn't have to actually whittle it down. So they're keeping 200 million of it, which they say they're going to spend on masks and, PPE and testing and tracing, but it's all kind of nebulous. We don't really know whether they will or they won't, or how are they going to explain to us how they spent the 200 million. So that's the controversy. I have a couple questions specifically. Don't we have any COVID-related expenses at the county jail? I know we've done a lot of work to releasing people, treating people, keeping people separate. So I assume you've checked that with the appropriate people, and they've said zero?
Yes, and I can push on that one again. We have a couple more days to see if there's anything out there.
And then care for homeless populations. I know we have our own person that's involved in full-time with the homeless population, Colleen, but I thought we've done some other things. We gave
hand sanitizers, all kinds of things to help with the homeless.
we actually gave away a truck that was worth $5,000. I don't know if that's actually reimbursable, but that's what it was for. It was to deliver water to homeless populations, to Jericho Road. But I guess I wonder if maybe there's things that are going on we should have some brainstorming about to see if they kind of qualify. Maybe Tom, you're kind of, I don't know who's in charge of this, but.
Yeah, Commissioner of the Jericho Road certainly is one that we can add to it. I actually had another thought about a big chunk of expenses that I don't see on here. On the fifth criteria, which is on page 8 of the packet, says expenses associated with the provision of economic support in connection with COVID-19 public health. The first bullet, it talks about support to businesses. And we've made, the commissioners have authorized several big chunks. The $100,000 grant probably hasn't been spent yet, but that would be part of the next wave. But we have done the
$73,000 that we did.
Yeah, and that one is, I noted too, it does say grants and doesn't use the word loans, but to be aggressive, it seems like we ought to give it a shot, include it. But you did authorize the $50,000 for childcare.
Right, $50,000.
Which I think certainly ought to be included. And so there's those series of large things. I know the 250 presumably is included in here in the other categories, but there's, you also, as part of your lottery exercise, you asked that additional funds be made available. And it doesn't specify what money you use under these COVID-related expenses, but you have identified COVID-related impacts to some of our service partners. So I think, and we're going to have a discussion on that this afternoon, we could identify a portion of those funds.
Those lottery, where we're really making up for lottery funds, or.
Exactly, yeah. So I think that's a large area to explore that.
Well, what I would do, I know we have a couple of days, James, is I don't know if you're in contact with any of the other counties, but every county's working on this week. It'd be interesting to see how they're approaching. I notice we don't have anything under other eligible expenses, so I will bet other counties are adding things there they've thought of or whatever. So it'd be interesting I don't know which counties to pick, but if you have connections with any, or we could find, we could go through AOC and find out maybe from Gina, which one's
Actually,
farthest along.
County might be a really good one to pick. Those commissioners, their case number is actually almost up to ours now, so they're having a lot of activity over in Umatilla County, and I'm sure they'd be very willing to work with us.
Klamath is another one that I know has done a lot with testing and stuff. They seem to be pretty organized, or Jackson seemed to be really organized. I don't know.
Right.
So Tom, are there meetings of a group that really work through this, or is this Greg and James primarily? I mean, they're great at getting the numbers in here correctly, but in terms of thinking through what have we done differently.
Well, I think Greg and James are assigned as the finance chiefs of the EOC. That part of the responsibility of other members of the EOC is to ensure that those expenses are channeled their way. So they're the official collector of all COVID-related expenses. And that's not to say that there may be some missing pieces out there that we can add, and those is certainly what we'll look for over the next couple of days. Beyond that, I'm not aware of any other kind of work group outside the EOC that's been involved in this. And I honestly haven't seen much of this on the county administrator or OCCMA listserv in terms of discussion on eligible expenses. I think this is kind of evolving as we speak, and we're all kind of in
We only had a week to do it.
Well, and this is the moment right now. This is our first board meeting. This is the first cut at it. So yeah, I mean, it's great we're adding just these items that we've really, made choices about in the last few weeks.
And James, another thing that did happen was there was food delivery to residents by our sheriff's office. I know they were going to La Pine and helping with that. And it might not be that much money, but every dollar counts. So I would be checking with them how often they've been doing the Meals on Wheels program, because there's mileage there.
So, Commissioner, I'll let you go, Greg.
I want to add a couple points here. So we've been collecting cost data and time tracking data ever since the beginning of this. In addition to that, in preparing for this, James has reached out to countywide to all departments with more specific requests on, is there anything in the county departments that we've spent in response to COVID that aligns with the eligibility requirements to send those to us. So we've sort of scoured the county. We do have a couple more days until this is actually due, so this is very much in draft format. So we'll continue to look into some of those other areas that were mentioned here. One other thing I do want to mention, and I'm going to ask that James elaborate on a little bit, is that number 5, the number 5 that's on page 8. I believe that the economic support funding is excluded from this round, but I believe we had that conversation, but I want to leave that to James to respond to that.
That's correct, Greg. The kind of, I don't want to say double standard again, but just the two differences in how the large counties and city is being treated versus us is really exasperated by this idea that in the governor's letter that they sent over for this first tranche of this first reimbursement request for March 1st through May 15th, is that they're prioritizing eligible costs related to medical expenses, public health, payroll for employees, and expenses to facilitate compliance with COVID-19 measures. And so they're not even opening the door up for us to submit those. And we are aware of those. We've made the payment on the $100,000. We made the payment on the $73,000. We've gotten the $50,000 check back from the city of Bend. All that happened last week, and we have those costs documented and tracked. And as far as a lot of the other smaller costs, the departments are involved with this, and a lot of those have come through. But there's a lot of things sitting on P cards right now that, or no, I shouldn't say P cards, but there's a lot of things that are still out there that haven't hit our books yet. So they're not letting us submit for reimbursement until we've actually incurred these expenses. We've paid these things. So we're going to have another crack at this. This is the one from March 1st through May 15th. So then we're going to have another one from May 16th onward. I did reach out to the state today to verify that, if there was any missed costs related to the past, the things that trickle in after the fact, then can we pick those up? And we're waiting to hear on that one.
So you've asked that?
Yes.
Okay, thanks, James.
So the prediction today was that the state's going to lose $7.1 billion over the next 3 years in lost revenue, and $2.7 billion in this current budget cycle. 4.4 the next 2 years after that. So that was the forecast. So we'd heard the number 2 and 3, so 2.7. Yeah, so that's what they predict. But they said that one of the other headlines is, let's see, on the same topic was steepest downturn since Great Depression. Oh, here's another one. Oregon predicted to lose almost $10.5 billion over the next 5 years. So, interesting.
All right, James, is there any Anything else? So Greg, it sounds like we're going to keep working on it, seeing if there's a few more things. So, we're getting we're under 1 million, and Washington County is getting 100 million. And we're not that small. So
it'd be good to maybe
Right.
have a list of the items that we think could be included that are, the guidance doesn't, allow them at this point, but that'd be good to just kind of have that rolling list of other items.
Yeah, and I don't want to, certainly follow up with Greg and James further, but so my reading of the governor's letter is all it says is that we will prioritize. I don't read
Yeah.
it to mean we can't include.
Maybe include,
those. So
yep.
One sort of strategy might be to go ahead and include those, even though they may not be prioritized. Maybe they have additional funds available, and all they can do is say no, and then we punt, then it goes to the next round. So we might want to throw in everything that we think might, and then stuff that doesn't get funded this round, we roll
over
then to our second request.
And then it'll be informative for, whoever's looking at these applications, for, citizens following this, to be able to see that list. This is the stuff that we think's reimbursable. If you don't, if the response is not at this time, at least that list will be there, and we can just start rolling it around until we find a home for it.
it's always better to have too much.
Yeah.
Than to fit, to get the funding back as soon as possible, I think would be really beneficial for our county and for our budget for next year.
Well, and they may be convinced to change their 50 million to 75 or to 100.
Yeah.
Due to, the comments and things. That
Well, we can
I do
coordinate.
think there's going to be a large county commission group.
Yeah.
Probably, and that we've heard at our phone calls, the same thing about cities, that cities are organizing to give their comments, so it may change, and it's all in their discretion, the speaker and the governor's discretion. They can do what they want, so.
Well, AOC and LOC coordination.
Yeah, okay.
Great.
So commissioners, just to wrap up here, unless you have any other questions, we're going to continue to work on this today and tomorrow, and we'll finalize the reimbursement request for Friday, and we'll circle back with you with an update on where we're at between today and Friday.
Excellent.
Sounds great.
Thank you, Greg.
Okay, welcome. Thank you.
Thank you.
Thank you.
So, Nathan, are you available? Who is it?
Hi, Commissioners. This is,
Okay.
can you hear me? This is Jennifer Hill at the Sheriff's Office. Sergeant Garibay asked me to log in to answer your questions in regards to the grant application that we've put before you.
Thank you, Jennifer.
Just to kind of add to what James was talking about in the CARES Act distribution, there's a lot of confusion wrapped around the emergency supplemental funding program that this application is for. So I can see how a lot of possibly reimbursable expenses might be missed that we can attach to it because it's just a really confusing process. So my thought to add to that would be, like you said, collect anything that might be reimbursable. We can also notify other local units of government that they can still apply for funding until at least the end of next week, and then whatever's left we can, like you said, punt to the next round.
Well, yeah, so, it looks like this is an opportunity for application, the amount of $35,435. So this is maybe the aspect, seeing this after the other discussion we just had. This is some of the public safety needs and expenses that are happening real time for this emergency situation. So this is just a application request. Is that correct?
Right. It's for
Yes,
the purchase
this particular application is for the JAG funding program.
Great.
Yes, for the
allocated amount.
For the 4 test kits for testing our N95 respirators, which do we have those?
The Sheriff's Office doesn't have any current test kits for our respirators. we had one, and I believe that it broke a while ago. So we do need to get these in order to stay compliant with OSHA.
Okay.
We're looking at 4 of them, and that would be for corrections, for the main sheriff's office, and a couple of substations, so that we can train people to be able to correctly fit test these respirators so that they're utilized appropriately.
Excellent.
And
So,
then
is there a back order on them, do you know, Jennifer?
there is currently, there's none in stock. So as soon as the funding comes available to us, which would probably be in about a month to a month and a half, hopefully there will be more stock for us to be able to purchase them quickly. But currently, yeah, they were sold out.
Okay, great. Good.
Okay, moving on to the other items, we have a request for some electrostatic disinfectant sprayers made by eMist. So these particular items are used in educational facilities as well as medical facilities. The backpack sprayer, we would want to look at purchasing 4 of these and use them for our facilities department at the sheriff's office. These will distribute over wide spaces disinfectant spray. And so we'd use those over at the jail, in the main offices, and all of the communal areas at the jail, as well as the main sheriff's office. They're perfect for our facilities department because they can just strap them on, walk around, and spray before everybody gets in and after everybody leaves. But in addition to that, we'll still continue having each employee use sanitary methods before they log in and when they log out throughout the day.
And Jennifer, these could be used, I assume, kind of going forward for however long we continue to do these processes. They're long-term pieces of equipment, I guess.
Yeah, the only recurring purchase is going to be the disinfectant spray. So, and it works with, let's see here. Yeah, it works with your average disinfectant spray. So that would be easy to purchase, low cost. So it's just the main units that are about $4,000 each. And yeah, we could continue to use these. It's a great method for quick disinfectant of large spaces.
So I'd move approval of the grant application for coronavirus emergency supplemental funding program.
And I'll second it.
Any further discussion? Commissioner Henderson?
Vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. Thank you for joining us today, Jennifer.
Thank you, Commissioners.
Okay. Eric?
Good morning. For the record, Eric Kropp, Deputy County Administrator. This item is to talk about events that are permitted by Deschutes County administratively. Just as background, on April 15th, the board passed Board Order number 2020-023, which required events being permitted in Deschutes County must submit a social distancing plan. That applied to events occurring in April and May. Just as an update, in the board's packet is a summary of the upcoming events. There is an update on one event on that list. The Tour Deschutes, which is scheduled for July 11th, has decided to go virtual, similar to Pacific Crest, which was scheduled for June 19th through 21st. So that's the update on that list. In looking at the list, the next event that's coming up is the Oregon Lacrosse Classic, which is scheduled for July 17th through 19th. That event is going to be a challenge because of to comply with the governor's order in terms of a contact sport, but we have not heard anything from the event organizer in terms of their plans on whether or not they plan to move forward on that. So for consideration, or the question for the board is does the board want to extend the board order, which requires the social distancing plans for events that are taking place in June or July? In the board's packet is a draft board order. Should the board wish to extend the order on the social distancing requirement. It's been reviewed by legal counsel. We don't have a board order yet, but if the board would like to move forward with it, we can get one on the spot.
I have a question, Eric. Do you think that our order is influencing the decisions of these various organizations? Are they aware of it?
They are aware of it. I email them updates. The governor's restrictions are impacting their decisions more at this point.
Because we have one set in June 27th for the 22nd annual High Lakes Show and Shine, and that's still pending.
Yeah, that one will be permitted by the city of La Pine, and then they route us the application because it impacts our county roads, and we just require the insurance and indemnification since they're county roads. But that's a decision the city of La Pine will make on that permitting.
And then the wedding actually was permitted then, August 8th?
Yeah, yes.
Okay. And they sent their plan in and everything?
They have not sent their plan yet, but that'll be part of the requirement.
Okay.
Well, so is the current order cover that, or the current order would have expired?
Yeah, actually, yes, you're correct, Commissioner DeBone. The current order just impacts events through May, and the wedding is scheduled for August.
So they didn't need to unless we extended into that.
Okay.
Thank you for that correction.
What about the J-Bar-J horse shows? Are they not permitted through us, or?
Correct.
That's all on property.
Yeah, what we permit is events that either use a county road or impact a county public right-of-way, or a commercial event that occurs on land that is not zoned for commercial activity. So there are events that occur, should the Sisters Rodeo gone forward, they would not need a county event permit because that's part of their land use.
We sure impact that road. Oh, it's a state highway at that point.
Yeah. They do. What about so how does the Oregon Lacrosse Classic affect us?
Or why do they require a permit? That occurs at Fraley Ranch out east of town, and Fraley Ranch is not permitted or is not allowed to have commercial activities. However, through this event permit process, they can have one commercial event every 90 days.
And I know J-Bar-J was still, thinking about what they could do with their show, because it is equestrian and it is on their property. Is that the difference?
I presume, I don't know the exact details of J-Bar-J Ranch.
It's covered through their land use.
Right.
I haven't had any recent input on this. I think, the community is learning about what responsible physical distancing and events look like. We're set up at phase 1. Phase 2 is be another, larger groups, possibly of 100. Our environmental health group is expanding service to kind of review, what's appropriate, what's the best practices, what does true cleaning look like. So, I'm not inclined to extend this at this time, just a starting point.
So I was coming down the opposite.
Oh, were you?
Yeah, I was thinking that since we're through May and June's getting here fairly soon, I would extend through June and July. I think from what I gather from all the input from health and things, it seems like the social distancing is a big factor in this. The places where the outbreaks have been, like the food processing or the long-term care facilities, are places where people work in close contact or a lot of close, and so I like that. I think in the end most of these will cancel anyway, so it doesn't affect it too much. But I was thinking my question was, should we go just through July or should we go all the way through August? But I'm open to doing it a month at a time.
I would go through July at the most.
Yeah. I do think it must be something they think about. And
When we're talking about social distancing plan is the requirement, so there's no limits other than a new requirement for a social distancing plan. Have we received one from anybody, or basically things have been dropping off?
Early on,
But then it didn't happen anyway.
an organizer that was not compliant,
Yeah.
that event decided to postpone their event, not because of that piece of it.
Yeah.
We're going to go back and forth on it.
But I'm just thinking, we don't have a lot of track record about the approval procedures and.
No, but I have been in contact with environmental health, and they have agreed to assist risk on that review.
I mean, we could always withdraw it too if things, we do all this testing and we're not having cases, maybe because I don't see it as I don't see it as a big burden on a event. To make a plan makes them think about how are they going to do it, I guess is what I see from it, rather than us saying, oh, this plan's wrong because it has this corner of the race, there's 3 people, there should only be 2. Or I'm more thinking that if they've thought about it, it's good. So.
Well, it was just like the opening up on Friday night. I think several wonderful places in our county hadn't really thought about implementing social distancing, and so they actually had to step in on Saturday and implement social distancing. Whereas I tried to go into the Verizon store and I need to have an appointment and I need to wear a mask, and it's very well laid out to go into the Verizon
And
store.
I was in there with Jaden, and you sit back, they have tape on the floor where your chair has to be from the guy.
Yes.
They were really well organized, so at the one here.
So, yes.
Well, so are we at all convincing Commissioner DeBone, or?
What if it's not unanimous?
It's a board order, so if the majority of the commissioners approve it, then and there's no emergency clause because it's not a.
Right.
What's your thought about not continuing it? I'm just kind
of.
Well,
long term. So this is, just heard from the health department. This is a long term, event. It doesn't look like it's going away. It's not like whatever dates we set are just dates. We're going to deal with it all summer, maybe in the fall, maybe even next summer before there's vaccines. So it's just kind of learning how to deal with this in our culture, in the events that people want to do. As soon as we have a successful event that's been reviewed by environmental health, because they'll be available. We talk to event organizers. They don't want the downside of putting an event on and having the media and a bunch of people get upset means it gets a bad name. So there's just a natural feedback loop there is kind of what I'm seeing.
Well, I think promoting social distancing is probably one of the cleanest things that we can do. It seems to be significant, social distancing and mask. And it's not always going to happen, but it's the suggested, recommended way. And, I just feel like we're reinforcing it with this order.
Just a personal note, so I go to the grocery store or the hardware store, kind of the places I've been, and putting the mask on, getting real focused. And yesterday afternoon, I find myself checking out at the auto parts store, and then I'm like, oh, I'm in another store. I just didn't even think about putting a mask on for some reason going to the auto parts store. And I apologize to the gentleman. It's like, I've been so diligent with this, but you really do need to get it in your mind, thinking, oh, okay, I'm going into another place of business with a counter and walking up and down the aisles. So not until I was almost done did I remember that, I didn't even have a mask on.
Well, I love the arrows.
Yeah, it was just a moment.
You just run to the store to get some little thing. And
well, grocery store is an event now, getting focused.
Yes,
I guess, so I would move to extend it. Phase 2 would begin, I guess, in June 5th. So I would move to extend it at least through June for now. But if it's safer to do it all the way through July, I'm okay with going through July, but we could remove it if we felt we didn't need it. But there's only a couple, we're really only talking about a couple events at this point. Isn't that correct?
Yes.
So could you be exact on that? Either it's June 30th or
July 31st. So I'd move to extend it to July 31st.
Is there a second? No. So the chair will second.
Okay.
So any further discussion? Commissioner Henderson?
I see both sides of this issue, and it's hard to kind of know the right answer, but I will vote yes.
Mr. DeBone?
No.
And the chair votes yes.
Right, thank you for that direction. And one thing to note is the social distancing requirements are the same either way.
Yeah. Governor's.
Plan just makes the organizer think about it.
Yep.
And
Okay.
And I've been involved with the Show and Shine, the Lapine, High Lakes Show and Shine. I've been there.
And that would be
for-
possible to do. I mean, they would be.
Yeah, so we'll see what they do. And I'll be available, and in fact, I'll be at the facility tomorrow. That's at the Lapine Senior Center, so I'll mention it, so.
Oh, I just have one really brief thing to bring up before 12 o'clock and we take our lunch break. But yesterday, speaking with the People and Sisters, Black Butte has been inundated with families, children, all kinds of people going around, and they were really hoping that we could encourage signs at entrances to Deschutes County, reminding them of since they didn't follow the stay home, save lives, they need to follow, still practice social distancing. Anyway, I sent an email out to a team of people everywhere, and I'm hoping that something will happen so that we can actually have signage here in order to reinforce that they left their home, but they're in our home, and they need to respect the people that are here.
We had a meeting yesterday with the Central Oregon Visitors Association, and it was mentioned, so Sun River and Black Butte Ranch specifically, that a lot of the folks that are at those homes are the owners too. So, I mean.
No, I'm not saying, but they still need to practice because
Yeah.
they're out with all their kids, and then all the kids, and they go into the market together, and.
But it's just trending a little bit towards the owners, truly the owners are using their own second
No, I
homes
think
now
that's great.
instead of
It's their
rentals.
home.
Yeah.
But I do, so I'm glad we're meeting and bringing this up in a meeting, because I'd had the same thought independently. I haven't done anything with it. But what my feedback would be is I wouldn't just, I think the messaging is very important, because we want to have a tourism industry when this is over. So a nice sign that doesn't just say, there's ways you do signs. I remember when Mountain Meadows was owned by a big construction company out of Portland, maybe still is, but their signs were, to disclaim liability, were so blunt, and it was always an example to me of the difference between Mountain Meadows and Bachelor, which was very tourist friendly in how they did things. They did it up there like a construction company, like you were at your own risk, and they put it on the poles. Any injury you have and it's just so how that messaging is done, and I don't know who you've put it out to, but I'd be interested in making sure, and I'd be in favor of not just one or two in the county. I could see 100 in the county to talk about, we're trying to keep Deschutes County safe, and I don't know what the costs are, but I think that's worth consideration amongst us.
We also went back to the billboard that's, Whitney was going to check on the billboard and see that we perhaps could use it that's being used for the RV park and use it on the billboard. But definitely there are 4 ways that people drive in, east 20, west 20, 97, north and south. So, and but more signs.
But see, I see it as, then you have the one outside Eagle Crest from both entrances, and you have the one outside Sun River, and you have it out, and you have it a variety of places. You have it in malls. Just as a welcome to Central Oregon, we're trying to protect you and our citizens. Please, I don't know how we do it. Maybe we have a picture of the mountains. Maybe we have a picture of the trees. A friendly way of saying this.
So actually, Whitney has put together some options for you on that at Commissioner Adair's request this morning. So she's prepared to speak to that either now or after lunch or at other items end of the day, whatever your pleasure is.
And also, remember, we have Central Oregon Visitors Association. There was a board meeting yesterday. The property operators, the resort operators, Mount Bachelor, the High Desert Museum, they all want positive, positive beginning, medium, and end on this. So and they're professional. COVA is a professional marketing organization too. So we can probably really make it a professional.
What I'm saying is,
sparkly. Thanks for coming. Please
push it. Maybe COVA would take the lead on it.
We're going to see COVA next Tuesday. They're coming at the beginning of the budget process.
I just, with what happened last weekend.
Yeah.
And the weather.
People are excited.
When it stops. We need all the rain here. What is it? They're getting it all over on the eastern side of the state. They're going to be over 100%, and we're, we're down in the 60s with the, Wiki Up and all those, the reservoir fills. So we definitely need more rain, but with the weather and with people coming and being so excited to be outside, it's something that we should have thought about like a month ago.
But we're thinking about it now, and
I know.
it's still not sunny, so maybe we have a week to
It was sunny
get
last
up the
time.
signs and
Yeah.
get it on the.
So Whitney, would you like to bring it up now, or would you like to do it at 1?
1 o'clock.
1 o'clock would be lovely. Thank you so much for working on that. Okay, so Stephanie. Okay, thank you, Stephanie. Good afternoon. We want to reconvene our meeting of the Deschutes County Board of Commissioners on May 20th, 2020. So we are actually, an item was just put to start at 1 o'clock, which is regarding signage for Deschutes County, reminding visitors that we do have suggestions that we need them to follow.
Another note, 2 o'clock interview has been scheduled for one of us. I mean, I had just responded to the email from a TV station in Portland asking about tourism for this weekend or whatever, for this
Good.
next weekend.
I
So-
saw the request, but I didn't know what to tell them.
Yeah.
I told him today after 4 or tomorrow morning at 8. But anyway, okay, so you said 2.
Yeah.
All right, so I guess you can step out then.
There you go.
Okay, yes, Whitney, thank you so much for so quickly responding.
Yeah, Commissioner Adair had asked this morning about any options that we might have in terms of getting signs in place to kind of share the message that we're encouraging folks to follow public health guidelines. And so I see that actually Chris is on the line, and Chris, you're welcome to jump in here too as I give this update. But Commissioner Adair had reached out to ODOT yesterday to talk a little bit about what might be options in terms of getting signs placed on the highways. And Chris and I had a conversation this morning about potentially using reader board signage and kind of what the rules are as it relates to that. Chris, I'm happy to summarize that, or if you want to, I'm happy to defer to you as well, whatever your preference is.
Yeah, go ahead, Whitney. I think we're both on the same page.
Okay, sounds good. So it sounds like Road is about to kick off chip seal season, and so they will be using a good number of their roadside reader board signs, but they do have 2 large signs that would be available for use. It sounds like we're able to use those, place those on county roads, but if they were to be placed on the highway, we'd need to make a formal request of ODOT to do that. And in email traffic this morning, it looks like ODOT's working on that to see if that's an option. And Chris has let them know that those signs are available if they do get the green light for that to be something that we can pursue. In terms of county roads, Chris and I talked a little bit about potentially placing a reader board on South Century off of 97 as you come off and head towards Sun River. That potentially, in thinking about visible county roads, was one location that kind of jumped as an option. And then unrelated to reader board signs, we also, Commissioner Adair had mentioned billboards specifically, and so I was able to touch base with Jeff Hines at Fair and Expo this morning. Fair and Expo has 4 billboards that they're currently using to advertise the RV park. If we wanted to, we could potentially look at transitioning those for this type of messaging, and I'm happy to give the board more detail about locations for those signs. Additionally, I did reach out to Carlson this morning, and they have 2 billboards available beginning in June. Neither one is probably in a location that was, I think, what Commissioner Adair was envisioning in terms of an entrance point to the county. They're both within the city of Bend, but I'm happy to provide more information on cost and location. But generally, that's what I was able to find out this morning as it relates to reader board sign options and billboard sign options. So
Great.
I don't know if the board has questions or wants to have any follow-up on that.
So I hadn't had a conversation about this idea with you or Chris. I actually was thinking of just signs, posting a sign with a good, nice message. Welcome to Deschutes County. Enjoy your stay. Please, follow the whatever, and putting them more specifically where people do traveling here see them. I mean, like billboards, we'll probably see them, but I don't know if, I mean, and there may be a chance that people driving by, but I was thinking more, kind of like more in the neighborhood, so to speak. I don't know if there's a law against doing that temporarily, but I can see some communities that would do that, and we could have, you know.
What about outside of like Eagle Crest? You know, there's the one main entrance to it. What about having some signage there? But I know we need something out by Black Butte, but that's ODOT. Or maybe something, I don't know, would signage right inside when they turn the corner off of 20 for people that are coming to Black Butte? I wonder, would they be in charge of that, or could we help them with that?
So, yeah, and I mean, we can get a map out like we do for campaign signs and pick the places, but there's lots of places.
Right.
I mean, there's out by the Pines, you know, State Park, and out by the, maybe all the things, all the roads that go up to the mountains, so people think about it as they're going out the mountains. I mean, just to, you know, you're going to be asked, you know, that reporter wants to ask us about what to do here. It's different. It's not like come here and have a great wild time and do whatever you want and this is a freedom. And it's like, well, we want you to come here, but we want you to do, you know, follow these rules, or I don't know. It just, can we do signs, Chris, like that with a post and a, you know, even if they're a couple $100 a piece or whatever?
Yeah, absolutely. You know, I mean, you're describing kind of a, you know, informational campaign over, you know, safety related to COVID, and there's plenty of examples of that type of thing. The drunk driving type signs, you know, kind of come to mind as a type of campaign where you get awareness out on the roadways. So, yeah, getting a theme and a look and a message put together, I think would be key, the key starting point for something like that.
Definitely a theme, a color scheme. I mean, so people start, you know, they start seeing them and they go, oh yeah, you know, I need to do this. Repetition, isn't it that important in the message?
Yeah, it is.
And Chris, just to clarify for sort of just education, would those be permitted just to be on certain roads but not highways, I'm assuming, or what?
So ODOT would have to approve anything in the state highway right of way.
Okay.
County roads.
They'd probably join us, wouldn't they? I mean, I wouldn't be surprised if they would agree to something like that.
Yeah. Yeah, I think ODOT would be, you know, up for consideration of that. The nice, you know, when you put signs on highways, they do have to be pretty big in order to get the message across at highway speed. So another thing to consider in something like that. But, you know, we can certainly have the conversation about it, and we'd be happy to do that.
Great.
So before the break, I think I heard the board say maybe potentially reaching out to COVA as a starting point in terms of talking about messaging and graphics, and I'm more than happy to do that if that's what the board would like to see happen.
Yesterday we learned that, yeah, they're basically working on a very scaled down information campaign, because it's not promotion right now, but there's resources there. There's professionals. They know how to really make it look bright and snappy, and they know how to get specific messages out. So I'm just saying we have professionals. They're our partners, funded by transient room tax. So
But yeah, and I think that's good to have them involved. But they also have never been really through this kind of an.
Oh yeah, no, I'm just saying use them for what
they're
they're.
Change.
Yeah.
It's not a forest fire. It's not a snowstorm.
Yep.
It's, you know, how do you? Because there is a risk if we're unfriendly. Like I think about how unfriendly the Oregon coast has been, and it would.
Yeah.
There'll be people that say, "Well, I'm not going back there. They didn't let us go," and there'll be people that have a reaction to it. So,
How about watch for, where he's got the sign in the back of his window, watch for deer? We could say, watch for COVID. You know, wear your mask, wear your gloves.
there you go. Starve the virus.
Yes, starve the virus.
Yeah, I think that's good, but it could be, you know, every little community we go into, you could do it as you know, in the entrance to Tumalo on both ends, or all three ends, you know, our little, you know, protect our resource, you know, whatever you want to say. You do it in Terrebonne, you could do it, you know, a whole variety of places. As you go to Smith Rock, places that tourists naturally gather, maybe it puts a calming on there. Because there are a lot of tourists here. I was talking to a restaurant owner, and she said this weekend half the people were her regulars and the other half were people just in town for tourism. I mean, so, and she's on the main street, so anyway.
Okay, so we're all going to, I'm just hoping that ODOT can come back with something, because I don't want it to happen like in September. We need this to happen now.
Good to have it in before Memorial Day, but
Well,
those flashing signs, you know, they had one of those on 27th Street that said, stay home, save lives. And I guess at the beginning of the whole thing, it still felt kind of odd, but it was like a tornado coming sign. But so I don't think they're very subtle. I think they're pretty black, kind of blast your face with it. And I don't know, that wasn't really what I was thinking, but it might be good in the short term.
Yeah, so short term, we have variable message signs we can get out. We have two that are available, and ODOT, is looking into, their ability to participate with that type of information. They have to get clearance on that from Salem. But we have at least two signs that we could position, on South Century or Client Falls or other county roads that could convey a real simple message about, hey, you're here, wear a mask, social distance, that sort of thing. We'll leave that up to Whitney.
Okay, great.
Fantastic. Did you?
Well, I was just going to say, so the board's not going to meet again for a couple weeks formally, but if you'd like us to do some things now, and then maybe come back with a sort of more of a campaign package for you to consider in terms of more permanent signs. We could go forth with the reader boards fairly quickly, and do some outreach with some of our partners, and then maybe bring back in 2 weeks or 12 days, would be our next meeting, a longer term sort of signage campaign for you to consider.
Yes, the sooner the better.
Well, I'm good if you just go forth.
Yeah, really.
I mean, if you want to check in with us and show us what you came up with, that'd be all right, but
And we'll, of course, want to change it. But
you'll want to change
promise
it.
we won't.
She'll add trees, I'll add a mountain, we'll water.
I'll put some horses running in the background.
But anyway, I think you should not wait for us.
Yeah.
I mean, we've kind of
we need
signed
to,
off on the idea. It's just
like we said, we should have thought about this like 4 weeks ago. But anyway, so we did, the sooner the better.
We'll touch base with you individually, and thank you for that direction.
Thank you, Chris. Thanks
You're
for
welcome.
being there, touching it. Let's hope that works. Great. So, Tom, you're up on the agenda.
Misplaced my paperwork here, but at any rate, commissioners, in front of you is a resolution that we prepared last week, basically formally lending support to the Stillwater project at the south end of Bend off Highway 97. This would not only lend support but authorize the waiver of property taxes over a 20-year period for the project. Just a couple of updates related to this. Both the City of Bend and Bend La Pine School District have already passed resolutions in support of the project. So they've met their threshold in terms of, or the developers have, in terms of the percentage necessary to receive the tax waiver, but nevertheless would still like to see support, would like a broader basis of support for the project. So we tried to check with Bend Parks and Rec District. We're not sure where they're at. Tyson O'Connell's on the line. He can probably speak to that in terms of the status there. Also, you had a couple questions about traffic related to the project, which I think Tyson can also address. We checked in with the city, and we received a copy of the traffic impact report. I gave a hard copy in Phil's basket. I think Phil had the primary questions, but we can certainly pass that around if you'd like to see it also. And by the way, that study didn't suggest any major improvements with respect to the highway. There's a long-term frontage road that really would take care of really frankly close access along the highway in that part of the parkway. Also, it's been through land use at the City of Bend and has its approval, I understand, in terms of going forward. So this is one of the sort of remaining pieces in the eyes of the developer to get this thing get it moving. So so unless you have any questions of me, I guess I'd have Tyson join us and provide either correct anything I said or add to it or answer any other questions that you might have.
So what a question I have is what amount of dollars are we talking about again that we are taking out of the property tax base?
I believe it was $40,000 per year was the estimated amount associated with, and that's across all of the different county taxing districts, the Deschutes County, the Law Enforcement District, 911, and Extension 4H.
It seems really low when an individual house like mine is.
Well, that would be based.
8,000. So why would this be
Only 40.
40,000? I mean, there's houses that are 10,000 or more.
Deschutes County's tax rates plus all the other tax rates for a house. So we're just talking, remember, we're just representing the first four.
You just said it was 40,000 for
17%.
Includes the city.
No, 40,000 for the county tax
line items.
So Deschutes County, 911, law enforcement.
Well, yeah, I don't. Whatever they give up is their business. But I'm saying, so you're saying it's $40,000 of our taxes per year times 20 years. So that's $800,000 plus a 3% increase. So it's over $1 million of subsidy.
So that number is the base rate, because that's an urban renewal district too right now. So there's other value that has been out there that, I mean, not for this parcel, I guess, because it's undeveloped, but it's an urban renewal district already, the Murphy Crossing one, isn't it? So it's kind of capped.
Yeah, I'm not sure if that district goes down that far. Could, I don't know that.
I think it was mentioned.
It says it's part of the Murphy something district.
Yeah. Okay.
So. Well, I drove out there this morning to see what it looked like because I knew where it was, but I hadn't really driven around it. And we're really at the tail end of this in terms of the city has approved it. I mean, we've got a lot of negative emails about it, but it's not really ours to approve or disapprove the project. It's just whether we're writing off essentially $1 million of county taxes to encourage affordable housing. I'm leaning towards doing it. I thought that the fact that there's construction costs are down low enough, 107 is what they quoted. That's better than some of what is called affordable housing that actually they spend $300 a foot building it. And they have one of the ones in Northwest Crossing has underground parking, has solar panels. I mean, nice granite counter. I mean, it's nicer than, so that's publicly paid for too. This one seems a little better. I did like the idea of the carports, but I see in their other projects that is typically they don't have the carports or some kind of coverage, which is makes it harder in the winter.
We do need 5 feet of snow, so.
We do?
We do need it at some point in the right place.
Oh, well, we get it is the other thing is
Well,
we get it, and it's really hard if you don't have any garage, but.
So logistically, with the other districts already approving an amount that qualifies for this already, so has the rates for Deschutes County already been spoken for, as in we're included already, once it's past 50%, 51%?
Actually, yes.
Yeah, so it's really, the decision's already been made. It's more of a moral support, community support issue.
Yeah, and I've watched, I've sat in here for many years now and watched the arguments where some districts will reduce their SDCs and Park and Rec never does, and it's been really contentious. And I do think if we're going to have affordable homes, we have to make them have less regulation and less costs because they just aren't affordable when you add everything up. So I guess that's where I philosophically come out in favor of the exemption, although I do hear the people that say we should give up those taxes. But
Well, considering our economy today and projected, I do believe that this affordable housing project is going to be really needed for our community. They're saying that it's going to be years before, if you look at the forecasts that the governor's office just sent off this morning. So I do feel that it's best to get it started now so that people will have a nice place to live.
Well, and if somebody has this information, the parcel, it was mentioned, I talked to a counselor, Bend City Councilor, that it was rezoned in 2007 for this type of development. So it wasn't part of the recent UGB. It's already been in the city and zoned for this. Does anybody have that information, confirmation of that? Yeah.
it doesn't surprise me. With the one that's in the UGB, I think, is right down by Murphy Road. It's actually closer to town. I don't know why, but it was a parcel that I remember reading about it, that it was added, and it had an almost a condition that it had to be an affordable housing project.
Yeah.
This is
So there's a long
something
history.
that someone's doing.
Tyson, did you want to add anything today?
I don't have a lot to add. I know all of you have heard a summary that I've given already, and you're asking some great questions. I think is it clear? Can you hear me?
Yes, you're fine.
I think just to touch base on a couple of those things, it is in an urban renewal district, and I think that urban renewal district actually goes a few years longer than this exemption request does. So that's something you could think about. The numbers that you're using are correct. It would be $40,000 a year for the county. We're using that to what we do with this real estate tax exemption is the bank will actually lend us more money because of the real estate tax exemption. So we're taking that foregone revenue that the Commissioner was speaking about, and we're leveraging it into about a $5.2 million loan. It helps us make the project happen. And I think when I presented, I can't remember the exact order, but I think the county may have been the first or second group that I did present to. But since that time, the schools and city have approved it. So we're already over the threshold of 51%. That's about 60 some percent that's already approved it. But I would still very much appreciate the support. I do acknowledge some of the public comments that we received. We received those as part of the record on our land use application. We actually did 2 different public meetings, I think I told you about, to try to address some of those things. And I feel we did a pretty good job addressing what was within our control on those. So I hope we can get your support. And if you have any other specific questions, I can answer those.
Thank you.
Well, one thing is you may have answered their questions, but it was kind of surprising, some of the emails we got, how hostile they were. I mean, it was surprising to me because we didn't really I only think I answered one, but because this is a area that has had a variety of uses next to it, and everybody kind of knows. I don't know. I just don't know the details. But anyway.
Yeah, I would say I wasn't quite as surprised. It's typical to get when there's a change like this proposed, it's typical to get some sort of public comments, and they're not always exactly on point to what you received, but they're somewhat similar. I wouldn't say I was surprised that we received so few. It's kind of about where I thought it would end up being. It is a change to the neighborhood. There's no doubt. We didn't do a change of zoning, though. We specifically chose this parcel because of where it was located and because of the zoning, which allowed the use that we're putting in. But it's something where I can see some of the concerns that people have. It is a change, and we've tried to mitigate as much of that as we can. And I've tried to tell them, although we're building it for an affordable price per square foot, this will be a really nice development. I mean, it's going to be very nice. I think when you drive by it, you'll be hard pressed to tell that it's not a market rate development, even though it is affordable development.
So I'd move board signature of resolution number 2020-020 approving a property tax exemption for Stillwater Crossing as authorized by ORS 307-.515 to 307 ORS 307.537.
I'll second it.
Any further discussion?
So just acknowledging, urban opposed to rural. We do have a lot of land in Deschutes County. We have a lot of land in Eastern Oregon. City of Bend is, growing and densifying. It's the right thing for some people, but it's not the right thing for everybody. So, just kind of bringing it to the highest level of state land use. It's wonderful to have these vibrant urban cores, but yeah, along with this, I would love, so this is a statement to the legislature and the governor at this point, but I would love to have the opportunity in the rural also for, urban, non-urban development in an appropriate fashion. So just acknowledging that.
Well, and I'll say something along with that because we've been talking about other subjects for a few months, but I really think that an exemption for taxes or other things are one of the few things we can do now, or if we can give land, which we've done also. But until we really look at those land use laws, look at the development codes, the building codes, and get the costs of things down because of so much regulation, we can't. If people don't like this type of thing of writing off taxes, somebody needs the flexibility to change some of that other things.
Yep. Yeah, this
allow houses to be built
responding
less
to the
expensively.
total expenses.
This is
construction.
one of the few tools we have in the toolkit, so to speak. So.
Okay. Everyone's made their comments except for me.
Well, you can make yours.
No, actually, I was just thinking, I'm so glad that our planning director, Nick Lilac, is going to have a new position starting the 1st of July on the LCDC board. And I feel like having Nick there, with Nick knowing the passion of what we need to do for our land use, I think it's really going to be very beneficial for our side of the mountain. So I know he will do as much as he possibly can. So that's the story.
Okay.
Commissioner Henderson?
I vote yes.
Commissioner DeBonne?
Yes.
And the chair votes yes. So thank you so much, Tyson.
Thank you very much.
Good luck with the project.
Thank you.
All right, so Whitney? Okay, the noise is back. Oh.
I thought it was a printer printing something.
I never remember from any before
I must be getting ready to break. Sorry.
Or it is currently being fixed. Thank you.
Where's the WD-40 at when you need it?
Commissioners, I believe this item, we should have Gabrielle Foot-Lewis joining us. I think there she is. And she's going to talk to you today about redesignating the Greater Redmond Area Enterprise Zone through June of 2030. And John Stark was not able to make it today, but Cappy is prepared to lead this discussion. So I'll go ahead and turn things over to you. Cappy, if you're able to. We can see you, but not quite hear you yet.
Good afternoon, everyone. For some reason, my video is not working. Been working earlier, but no worries. Can you see my screen?
Yes, we can.
Oh, wonderful. Thanks. Good afternoon, commissioners. I'm here today with this resolution 2020-021. It is redesignation of the Greater Redmond Enterprise Zone for your consideration. We have had the City of Redmond and the City of Sisters. We did their presentations last week and both cities signed as co-sponsors. And I'm here to present a PowerPoint, sort of review what we discussed back in February. It was February 12th that we had the meeting, and John and I were able to present to you some data and information on the enterprise zones. Unfortunately, John couldn't be here today, so you can address any questions to me, but If you would like, I can go ahead and start with the PowerPoint presentation.
That would be great. Thank you, Kathy.
Great. So much of what I'm covering today we did already cover, but I want to make sure that any questions that you have are addressed. We did meet with our taxing districts, both of us, and there was a taxing district meeting for the county as well. Those went very well. We answered questions and clarified the program as a temporary abatement on property taxes that encourages job creation. It is not an urban renewal. We constantly have to have that conversation just to make sure that everyone is very clear of the intent of the program and that it is a temporary abatement on property taxes for qualified investments. So let's go ahead and start. I'll quickly go over, we won't need to go into too much detail unless you have questions, the history, how the program works, local benefits. We had some great help with mapping this year. The City of Redmond really helped us with some GIS, so we have much better mapping than we've had in the past. And then the resolution. So again, it was established in 1988 in Redmond, renewed in 1998, 10 years later, and in 2009, Sisters was added. The Sisters Airport was included in 2013. It's not actually the taxiway, but the adjacent property. And we are trying to move this forward to Oregon Business Development Department by June 1st. Again, it's a tax abatement on qualified property. There are 73 zones statewide. Typically in Sisters, we have a 3-year program. We have not yet had a project that we went for 5 years, but that could be coming. 5 years, in order to do a 5-year abatement, the average compensation for new net jobs need to exceed 150% of county median income. So above 68,357.
Kathy, is the 68,000, is that the median income now that you have to go above, or is that the number that they have to reach?
It has to exceed above that. That's the county median income.
Okay, so it's got to go 1.5 times that number.
Yes, I'm sorry, that's not the county. That's 150%, 1.5, yes.
Yes, okay, thank you.
Does that clarify? We are still designated as a disadvantaged area, and we expect that, given COVID situation, to continue, but the numbers do go back to community survey and census data. It cannot exceed 15 square miles. Again, we've got sponsorship from 3 partners, public partners, City of Sisters, City of Redmond, and Deschutes County. It is zoned for employment land, typically. That can be downtown commercial or highway commercial for projects, but it still needs to be qualified as traded sector. This is just an overview of the program since Sisters was designated in 2009. There's sort of a delay. So when we start going through the approval process, by the time it actually, you see the abatement in the Department of Revenue reports, there is a delay. So it's really interesting to kind of go back and review all of the Department of Revenue reports and see what the impact has been. For Sisters, it's been 247 jobs to date and over $14 million in qualified capital investments. For Redmond, significantly more, longer in the program, and a much bigger city. 154 firms have been involved in the program in Redmond, over 3,300 jobs and over $165 million in investment. So significant impact, return on investment. This is a review of Redmond's local incentive package. Redmond would very much like continued support through that. They do have their own building department, so they're able to make some of these waivers work and some reductions in their system development charges. In Sisters, we simplified. As you know, we do outsource our building department to the county. And because of that, we've decided to simplify, and we came up with a program, the Sisters Forgivable Loan, City of Sisters Forgivable Loan Program, which we feel businesses have a choice on what their needs are when they transition into Sisters or are expanding in Sisters. So we wanted to provide a maximum flexibility and let them decide where they need it. So they could use them on system development charges or transitions or job training or even transportation of equipment into the City of Sisters. And we do want to still do the application fee waiver. And we're hoping for continued expedited permitting, which basically, when we talk to most of our client companies, whatever the process can be to expedite permitting from a standpoint of traded sector projects that are highly impactful and jobs creating projects go to the top of the pile.
So Cappy, just looking at those, I was just comparing Redmond's to Sisters. Redmond's package of incentives is pretty significant. It seems like businesses would definitely look at that and add up a lot of money. Have you ever thought of adding things to Sisters, or are you more selective in the businesses you want, or what's the difference there? Why? I know it just...
Yeah, thank you for the question, Commissioner. I would say it's kind of a combination. For Sisters, it's not a, come all. It really needs to fit the values and culture of the community. And yet we know how many leads it takes to generate a project in Sisters. That's definitely more challenging. And we did have those incentives included in the last resolution. The change had been when we outsourced our building to the county. We can't control those fees, and it was a lot to ask the county we can't define what that budget number would be, if that makes sense, for these projects. The city, we kind of tested the water with the city in terms of SDCs, and that really wasn't something that they were interested in doing. So I guess in lieu of this, yes, it looks like and it is, it's a huge incentive package that's worked very, very well for Redmond. Given the light of the changes, it just wasn't going to work as well in Sisters. Our forgivable loan program, we've only deployed it once, but it can actually go up to $5,000 per job created based on the criteria and going through return on investment analysis on that business and those jobs and impact in Sisters. And we really felt that that in lieu of not being able to provide this particular incentive package, we don't have water and sewer hookup fees in Sisters. So, as we really analyzed this, we felt that the forgivable loan program could do just as much, if not more, depending on the business needs. So it was challenging not to have this available, but we did come up with a creative solution. Does that answer your question?
Yes, it does. Thank you.
And we would like to continue with the electronic commerce designation, though, since it's sunsetted, the income tax credit portion of that sunsetted, we still do look at personal property benefits. So if you've got, say, a bunch of computers that are running a production facility, as long as they're part of that whole system, they can be included in the temporary property tax abatement. And so it's really, as we look to the trends, and we've seen the trends of, high tech being able to live in more rural communities and impact them with job creation, jobs and capital investments. We do like to see those this benefit. We're seeing the companies that have been successful through the early months of this pandemic are heavily dependent on e-commerce. We like to see multiple revenue streams with our companies here locally and in the region, and that e-commerce section is super important. So if we can tie some of this personal property back to their revenues and their success, we want to continue to support that. So we would like to certainly reapply with the e-commerce designation. And then we go into some mapping, and so you can see this, both the Redmond and the Sisters and Deschutes County 10,000 foot level of the mapping in designated areas. And then there's a second map in your resolution that was really, again, so helpful with GIS to really kind of zero in on the exact parcels as well as acreage levels, so we could make sure that we were compliant. And then this is just a review of the different meetings that we've been to make sure that we're getting the support and we're answering any questions and concerns. And that's all I had for you today.
Great. Thank you so much. Do you have any follow-up?
Has Redmond City Council approve this?
Yes. So, can you see my screen still?
Yes.
Yes.
So here's the formal resolution. And if we continue down, we've got Mayor Endicott and City Recorder Kelly. Signed last week on the 12th, and then on the 13th, we've got Mayor Ryan and our City Recorder, Carrie Prosser.
Oh, okay, great.
And in this resolution, this is sort of that the map that we've had used in the past. And then you'll notice as you we did a lot of, the boundaries did not change, but we did a lot more in the mapping. The mapping did take some time to go through, and City Redmond's legal team reviewed the mapping as well. So we feel real confident in it. And then the second map, where is it? Here, as you can see, is much more detail. So we really appreciated that effort as we zone in on sites for potential transferring companies and those that want to expand here locally.
Looks like the fairgrounds excluded from that. Is that true?
I
think that's the white, in Redmond, I think that's the white box.
Yeah, this is definitely the airport, and then here.
Yeah, I just observing it. Well, it's exciting to be able to provide tools for our economic development folks like yourself, traded sector, creating a product or a service, being able to sell it outside the area, and bring in those traded sector dollars is a wonderful mission and goal. And we do have success in Ben and in Redmond and Sisters, still working on Lapine, but someday it'll happen down there. So I fully support this.
Great.
And the only thing I'd say is that, I don't know if all of these things that Redmond has that Sisters doesn't have are up to the Sisters City Council, but if there are things that the county could be involved with, or the beneficiary of, we could talk about those, in my opinion.
Well, we have been in the situation where expedited permitting is the terminology, and I think Capriel, we've been in that situation, haven't we? We're like, okay, well, we want to respond, but we do respond very quickly. So that's something we can advertise and gives confidence to the who come in to get involved. But our community development department does such a great job. So,
but I know what I'm.
Oh, the rest of them, I know.
A lot of them, I don't know if they're just going.
They're all monetary.
Sisters,
yeah.
Even though we do the land use, I don't know if the fees go to us or. That would just be a matter of later discussion, I guess.
Right.
They do their own land use, we do the building.
Yep.
So like Redmond has a 2% reduction in building permit fees for every new job created, up to a 40% maximum. That would be up to us to make that decision for our process, for a Sisters business. Okay.
So, how does that sound, Cappy? Let's remember that statement.
Sure, we can talk about it with our advisory board. If there's some interest from you to explore that, we'd appreciate that.
No, it would be.
With that, I'll move board signature of Resolution 2020-021, Greater Redmond Enterprise Zone reapplication process.
I'll second it.
Any further discussion? Commissioner DeBonne?
Yes.
Mr. Henderson?
Yes.
And the chair votes yes. And thank you so much for the presentation.
Unanimous.
And
Thank you very much.
for the idea on the sign.
Thought I'd sneak that in real quick. Thank you very much.
I'll pass it on to Ms. Whitney if you have it.
Oh, another concept for the sign?
Oh, yes, she had one.
Good.
What was hers? It was very cute. Help us recover 6 feet or wear masks. Thank you.
Oh, yeah. How do you get a good message in a short little?
Yes, like how fast can you go by that sign and read it? Thank you, Kathy.
We want to recover quickly. Thank
Yes.
you so much, everybody.
Thank you. Okay, so now we're up. Is Janice available?
Yes.
Okay. Good afternoon, Janice.
Good afternoon, commissioners. Are you able to hear me?
Yes.
We are.
Okay.
I am here today for Health Services Behavioral Health to request permission from the board to approve acceptance of Certified Community Behavioral Health Clinic Expansion Grant dollars. This grant will fund 13 limited duration existing FTE and an additional 6 FTE limited duration positions as described in your agenda item. We learned on April 24th that we received this award. This is the second of a 2-year CCBHC grant. So as you know, we received one originally in 2018. You have a copy of the notice of award. The project expands on DCHS's current CCBHC expansion grant activities by maintaining increased access to services for individuals with serious mental illness, substance use disorders, co-occurring disorders, and serious emotional disturbance, by increasing access to mental health and substance use treatment for homeless, incarcerated, non-English speaking, and rural participants. The grant this time funds 19 FTE in total. As I mentioned, 13 FTE were part of the original grant, which funded 18.5 FTE. So there's an add of a 0.5 in total add, and then 6 new positions. Those 6 new positions were really focused on adding some resources to our South County La Pine hub and adding resources for aid and assist work in our downtown clinic because we've had some increases there.
So,
The
Anna,
grant will.
so on that, I'm trying to track how we've changed over time. So does that mean you went out to get another 6? You asked for 6 more people so you could expand the program into La Pine and downtown Bend?
Well, what it really means is that in order to make this a competitive grant, when we reapplied for the funds, we changed some of the positions that were being funded by the grant so that we could expand to our South County office, which really needed some additional resource, and then address a couple of other specific needs. One is our homeless population. This grant adds a community health specialist 2 so that we can now have 2 specified positions that support our homeless population. It also adds an aid and assist peer because we did not have peer support resource readily available to our aid and assist population, which has expanded significantly. And it adds a language access coordinator function so that we have better oversight of resources for primarily our Spanish-speaking population, which is where the major language needs.
So when you say in here that we're going to keep 13 of 18.5, are we actually letting 5.5 go, or are those 5.5 shifting over to this new 6 people?
Some of those positions ended. Many of them were vacant. Some individuals who were in those 5.5 positions bumped back into a previous position that was vacant. And I believe that 2 individuals are specifically impacted in terms of that position no longer exists.
So you're really saying those 5.5, we really are cutting from 18.5 to 13. Of those 5.5, different things have happened. They were vacant or they're moving somewhere else. But the other 6 you're talking about are new hires, basically?
They would be new hires.
Not the people we already had. It's not, you see what I'm asking? It's not just a shift
Yes.
of personnel. Okay.
Yeah.
And then the other question I had about this is we first were applying for this when I first took office, so it's over 3 years ago. Is somebody doing a report of how all this went from, some level, 30,000 feet, 10,000 feet, 100 feet? Because this was all a pilot, and I'm sure there's certain things that have been working well, and there's probably things that didn't really have much impact, and I'd be interested to know what's been learned.
So we had, as you recall, we had 2 versions of this funding. One is the demonstration grant, which continues to operate in the background, and then this grant, which is a very traditional expansion grant. For both efforts, historically, when we had the CCBHC demo, I'll call it for short, we were providing all of you, our Board of County Commissioners, with quarterly updates originally. We have not done it as frequently because it's, to some degree, it's become old hat. It's sort of how we operate now. When we applied for the expansion grant, we applied with a university evaluation partner, and they will be a much smaller part of the grant this time around, but they did produce an extensive annual report for us, which I'd be happy to share with the board. It has lots and lots of information about how this grant has performed and where we're still struggling to meet certain metrics.
What university did you work with?
It was Portland State University. It's their Center, I think, for Child and Family Research. It's a very long name, but it's a research partner that partnered with us on this grant. And then the third way that we've been letting you know how we're doing with this grant is when we provide budget presentations to the board and to the budget committee. We've always tried to include as much data as we can about how we've performed specifically as a CCBHC, because for behavioral health, really most of our performance metrics now are either related to our status as a CCBHC or to our contract with our CCO. And they tend to focus on very similar things, which is better health outcomes, diversion from higher cost settings, follow-up after hospitalization for a mental health or substance use condition, and those kinds of things. And I'd be very happy to share the report with each of you. It's lengthy, but interesting. And part of that report did include interviews with community partners about their experience of this effort that we've been involved in.
Janice? I'm not,
yes, ma'am.
I have a question. There's no match with this then? It's just straight federal dollars?
This is straight federal dollars. It only allowed a 10% rate for indirect costs.
Right.
So to some degree, there's an unofficial match, and we certainly made our grant application more competitive by identifying a number of in-kind services and staff time that we provide that help support the efforts of the grant. But there is no match requirement.
Okay, and then I did notice that the marijuana special condition of award.
Yes.
I thought that was, I guess I hadn't read that before in a document, but I did see it there that the grant funds may not be used directly or indirectly to purchase, prescribe, or provide marijuana or treatment using marijuana. So
correct.
As an exclusion.
No research.
Yes. So anyway, I just thought I might want to point it out that, we're getting $4 million for a program that I'm so happy that you're running here in Deschutes County.
Mm-hmm.
It's nice to know that it's going to continue.
It is good to know that it will continue.
I hope, as long as we approve it, right?
Indeed, as long as you approve it, it will continue. Approve acceptance of the funds.
Yes. Okay. Commissioner Devon, did you have anything else?
No, I'm ready for a motion again.
Does someone want to make one?
So,
Well, I may have cut her off. Did you have some other things you were going to say? I just asked a question, then that led to several other questions, but I don't know if you were...
No, I think the only other thing that's pertinent is that when SAMHSA released these funds, they changed the date of the period of the award, which did create some complexities. But we were able to make some adjustments in the grant budget so that the project really will start next fiscal year and be part of that, is already part of the budget. So
there was an overlap in funding or something.
There was an overlap, yeah. And it likely will make it necessary for us to request a no-cost extension and fingers crossed get one at the end of the award period, because technically this award ends April 30th, 2022, and we would hope to stretch it to at least the end of the biennium.
Does getting this done this week make it easier then for next week for the budget, that we're then going to include all this in the budget?
Absolutely. It makes it easier, and makes it easier to respond to our grant program officer as well with the budget adjustment. we didn't want to submit a budgeted adjustment until the board was informed about the funds and had
Well,
awareness of this project.
As you know, you already have your binders for next week, so this is, this wouldn't be reflected in the reports that you have, so it's something that we'll point out to you, the information that we know now that we didn't when we finalized and printed the recommended budget. So we'll sort through that and explain it to you next week.
And Commissioners, Cheryl Smallman, our finance officer, is on the line. She's currently muted, but may have some detail to add to that particular point. I don't know.
Yeah, it's just to clarify, we built it into the budget as a contingency. So if we received the funds, then it's already in there. This will approve that. The only change that will need to occur really from now to the adopted budget would be the change in FTE, change in staffing. So we'll walk through that next week.
Great.
Thanks, Cheryl.
Thank you, Cheryl.
Well, with that, I'll move approval of acceptance of the Certified Community Behavioral Health Clinic Expansion Program Grant.
No, I'll second that. Do we have to, are we passing a resolution or something, or? Guess not. So I'll second that.
Okay. Any further discussion? Commissioner DeBonne?
Yes.
Commissioner Henderson?
Yeah, the only discussion I have is that this program's lasted longer than we initially thought. I mean, it was a 3-year program or 2-year program starting back in 17, and here we are in 2020, going on to 2022. So it'll be 5 or 6 years by the time we're done with this grant. So interesting.
Well, and if it's a new way of managing severe persistent mental illness and other needs in our community instead of state institutions, and I mean, this is their world, but this may be the future model that gets funded, federally and state-wise also.
The federal government seems motivated to keep looking at it or working on it.
And don't forget, Janice, is this the same? Are we one of 8 states that have this opportunity? Or did they?
Well, the expansion grant expanded to an additional, I think, a total of 20. I don't want to misspeak. It was many more than 8 states. It was a much larger group. So the expansion grant did broaden the amount of people that could qualify to apply. The original demonstration grant, which we are still participating in, was extended to 8 states only, and I believe that may still be the case. And then we are now one of 3 instead of one of 2 Oregon County Community Mental Health Programs that received the grant. I believe that in addition to the Roseburg area, Cascadia in the Portland area was also an applicant and received the expansion grant. So that's good news for Oregon.
Oh, that's great.
Yeah.
So I'll vote yes.
Okay, yes, and the chair votes yes. So thank goodness I could remember. Thank you, Janice, very much. Thank you for all.
Thanks
that you
very
do.
much.
Be safe.
You too.
Commissioners, if you wouldn't mind, can I briefly ask for clarification on an item that was in front of you earlier today on the testing program that we're doing in conjunction with OSU Cascades? You had asked to see the MOU that we're proposing to put in place between the county and OSU Cascades, and that was, I think, distributed to you earlier. I'm not asking that you go through it now, but if you wanted us to wait on moving forward with the program until you have a chance to look at that MOU formally, or if you just wanted to see the MOU as a point of information and if we're okay to move forward in putting the program in place.
I believe I just wanted to see it as for information.
Well, I guess I'll just, the point of showing it to us is if we have any comments, really. I didn't expect to do it in the middle of the meeting or even today, but is there some, are we holding up the show or something, or what's the?
Well, I think they're ready to move forward, to launch, to kind of put things in place, but if you
why didn't we get it before the meeting then if the MOU is ready?
A good question. I thought it was included in what George sent over the weekend or last Friday, but perhaps it wasn't included in that packet. But
Well, I mean, I would support stepping through it real quick because, I mean, I don't know if you'd feel comfortable doing that. There's not much to it. I brought it upstairs and I didn't bring it back down. But yeah, because, I mean, if we have a research effort, university-funded testing of 500 or 600 people, what a great opportunity. And I don't see a lot of downside. So just looking at the line items. So now it was put off till 2:10, but I'm going to step out and go do a quick interview, and I'll be back after this.
Well, I got the test or the information, but I must have left it at my desk. Do you have your copy here by any chance? Or
No, I brought mine.
Took it upstairs.
maybe. Do you have yours, Commissioner Dare?
Of course I do. It's buried somewhere. It's here.
I guess, you know, again, I'm excited about this experiment that they're doing, but it really isn't health. It's an experiment. They're doing a bunch of testing, and it's great science, but I'm surprised it's urgent. But because we heard about it Friday.
Got the email Friday afternoon late.
My understanding from Dr. George over the lunch break was apparently they have a marketing campaign or publicity type campaign that's ready to go and they want to get that out, but obviously they're not going to do that until the IGA is signed. So he did call and ask if he was authorized to sign it, and Tom and I indicated that we'd double check with you folks here this afternoon.
Okay. Well, I just hope that the students that are participating looked more protected than what I saw on the TV show, the TV feature. That's really, because I saw them, it was featured on the news one night from Corvallis showing, and you know, I would have thought if they're going to go around and take samples from people, I would have thought they would have been like all gowned up and everything. Wouldn't you have thought? Yet they really weren't. So, but you know what? It's, you know, they're the medical people.
I could note there's no dollars associated with this, and there is a opportunity to this on 10 days notice. Either party can terminate it if it's not proceeding. I think the bigger issue was whether the board was comfortable with this type of testing in the community.
Well,
Is it really our permission to give? I mean, why does we don't rule the citizens, so.
Right, was whether the county was comfortable being a signatory to this intergovernmental agreement with OSU to come into the community and do that. I suppose, I don't know, I suppose through OHA, maybe OSU could do it independently without the county's involvement. I didn't really explore whether that's an option, but I think they wanted to
I think they're doing with Deschutes County Health.
have the county on board, yes, a local public health authority.
So,
It really doesn't,
it really doesn't look like any part of this agreement says that the students will be properly protected. You know, that was just my observation from, you know, just what is it, a minute, you know, newscaster interviewing and filming the students walking door to door. So, you know, maybe they were just practicing. I don't know.
you know. So
I
do
don't
you
think
want to
they
add
would
that
be
as a
happy.
line item? My wife would not be happy.
No, because she would want them all, you know, gowned up.
Gowned up, yeah.
I mean, remember how we heard how important it was to protect the test takers? Now, they're probably not doing the test. They're just there recording or something. Who knows?
Well, we could make that a restriction,
Well,
add a 3-point something or other.
You could add that to 3.5 if you would like, that the folks conducting these activities will be properly masked and gowned as determined
I like
by
that.
the health,
Yes.
public health
I like
people.
I
that.
would feel better just because I honestly saw that.
Maybe they're doing the simple swab rather than maybe they've got an Abbott machine or something, and they're just doing the simple swab, not the, was it the
But no,
pharyngeal?
They were talking about taking, what was it, 48 hours to get the result? So the Abbott test, isn't that the quick test?
Yeah,
that you get?
but maybe
Yeah.
I don't know,
I know.
I mean, I'm fine with it otherwise. It doesn't really obligate us to do anything, so it's kind of a funny agreement. It just says we're
I would feel better.
doing
though.
something with them, but it doesn't say what we're doing or what we're responsible for or what our liability is, or
Right. They're,
kind of goofy.
I think it's more of just to get a tacit blessing of the local governing body for OSU to be here doing this in this jurisdiction. At the end of the
I would
day.
appreciate that. I would appreciate adding that, Dave.
So then we could add that at the end of 3.5, that staff performing testing will be properly masked
Sample, actually, they're
or
taking.
properly protected as deemed best practice by the local public health administrator.
Perfect. That would be
And do you want to put anything in there about the people doing the testing, they're going to the door, will be
Yes.
so civil or, I mean, that's another thing. People could get upset that we've authorized these
Yeah.
people to come out, and I don't know what the wording would be, but
I know.
Well, I can work on some language and maybe suggest
I'm-
it back at our next break
yeah,
Sure, that'd be great.
that's fine. You know what I'm saying about like,
when they introduce themselves.
yeah, that'd be, friendly's not the right word, but
They have to have like something big that says like Oregon State University, white coats,
oh, well, I'm not. I don't know.
doctor's coats.
I mean, just that they're gonna be, they're not gonna be forced, they're not gonna, you need to take this because if you don't, something just saying
Congenial.
congenial, social, friendly, whatever.
Okay.
But really, the thing, it gives us some rights, which is the right to get the information, which is great. I don't know, but we really can't authorize them to come to the, okay. Is that close enough?
Yes.
It is for me.
We'll draft some language.
It's interesting. I know we probably don't have any health people on this, but the city of Bend gave us that one news release on May 6th regarding the testing, the COVID testing in the wastewater samples. But have you seen another one from them? Because that's, I think it's fascinating that the first one had this big number. It was 580, and then it went to 0. And I'm thinking, like, how good is this testing if you've got 580 and then you go to 0 the next week, and then they went to 1,200. But the last test that I received was April 21st. So
A month ago.
yeah, I really think that test is something that we should see what's happening. Anyway, I'm not quite sure who did this as a news release because I just have it in my binder. But, as long as we're doing all this scientific testing. And that's all anonymous, so it's not like HIPAA laws. But I wonder how accurate it is if they have a 0. Like,
Well, would this be something we do a press release on so that people know that we've, because I thought it was kind of interesting when Benton County said they were doing it with OSU. I mean, that sounds kind of forward thinking or something. I don't know.
You're talking about the test sampling and.
I'm on to a different subject.
Yeah.
I don't know what to do about the sewer situation.
Well,
I know what you're saying.
I just think it's, if okay, we're going to be testing here and now we're testing there, it's nice to have
Feedback.
More information.
Yeah.
Well, I can check on that. I think we're kind of the silent partner in this more than anything else, but I would imagine they'd do some kind of media press. I don't know if that was.
Well, I think our health department's all over it, though. I mean, they know George knows all about it.
He does.
Passing.
But he didn't pass any information on. When I said, George, how could they have 0 one week? You would think they would have done a couple tests and maybe they would have had to average them. But to have actually the report said 0, that's very. Is that? Yeah, that's like okay here.
All right, what's next?
Okay, so let's go on. Thank you, Dave, if you could do that. Okay, so now we are at Izzy. Isabella?
She's there.
Oh, yes. And Isabel, we hear you're going to be moving to Portland.
I will be, yeah, I'll be leaving Deschutes County at the end of the month.
That's too bad. I didn't hear that.
She likes
Yeah,
people.
Congratulations, I guess, but I don't like you to leave. Good working with you.
Yeah, it's been a pleasure working with everyone. It's certainly a good group.
Thank you.
Okay, for the record, Izzy Liu, Deschutes County Planning Division. Today the board is tasked with deliberating on the proposed text amendments related to House Bill 2106 and House Bill 3384. The board conducted a public hearing back in October 30th of 2019. Following the hearing, the record was left open until December 31st, 2019. The record was left open until the end of the year because at the time, staff did not have a copy of the rulemaking packet from DLCD, and we just wanted to make sure that the proposed text amendments would mirror state law. So earlier this year, I got a chance to review the rulemaking packet, and there were no changes specific to House Bill 2106 and House Bill 3384. Since the public hearing is quite a while ago, I will provide an overview of each of these bills and go over how it will affect the Deschutes County Code. So House Bill 2106 was enacted in June of 2019. This will allow 5 additional one-year extensions for dwellings in the exclusive farm use and forest use zones. Just as a refresher, dwelling approvals in our resource zones receive a 4-year approval, and then property owners could extend that approval for an additional 2 years. House Bill 2106 would then allow 5 additional one-year extensions after that initial 2-year extension. So this would affect Title 22, which is the county's procedures ordinance, more specifically the expiration of approval section. As of the end of last year, there were 66 valid approvals for dwellings in our resource zones. House Bill 3384 was also enacted in June of 2019. This allows the expansion of non-conforming schools in the exclusive farm use zone, including all buildings that are associated to that specific use. This would affect Title 18, which is the Deschutes County's zoning ordinance, more specifically the non-conforming uses section. And in Deschutes County, there are 2 non-conforming schools. As I mentioned earlier, these laws are in effect today, so staff did prepare an emergency ordinance for the board's consideration today.
But in order for us to have an emergency ordinance, don't we have to, do we have to have 3 to vote in order to make it an emergency? So.
Yep.
Be back.
Yeah, you could defer this until.
We're going to need to defer this for a few minutes.
Is there anything else we need to do about it, or?
Is there any? Yes.
Unless you had any other questions for me, this is essentially deliberations and considerations kind of all rolled into one today.
Okay. Oh, we need to deliberate. Okay.
As if on cue.
Okay. We need you for the emergency. We need for you for the deliberations. Okay.
So I'll move first and second readings of ordinance number 2020-022, amending Deschutes County Codes Titles 18 and 22. Do I move approval now too, or just first readings?
First and second reading.
Didn't I say?
By title only?
But I think it didn't say that. But yeah, first and second readings by title only of that ordinance.
Including an emergency clause?
What?
I think it also includes the emergency clause, so.
Okay.
Right.
I'm just reading from the title here. Okay, including an emergency clause.
I'll second it.
Disjointed
Okay.
Just doing motion.
So it has been moved and seconded. are an ordinance amending Deschutes County Code Title 18 and 22 to incorporate changes in state law related to the expiration of approval of residential development in resource zones and allowing the expansion of non-conforming schools in the EFU zone and declaring an emergency. So any further discussion?
Just acknowledging the emergency is, more of the housekeeping version at this point, so the emergency clauses could get interesting if somebody takes.
And she said that with the rules are actually, it's all in effect already anyway, so that was how she justified it, so.
But I mean, to say, we declared an emergency with COVID-19, now we're declaring an emergency for this.
Yep.
So it's just a little bit different intention here.
Okay. Commissioner Henderson?
I vote yes.
Commissioner Devon?
Yes.
And the chair votes yes.
I think you did first and second reading there as part of your motion, so now you would just need a motion to adopt ordinance.
We need a motion.
So I'll move to adopt ordinance number 2020-022.
Okay.
I'll second it.
Further discussion? Commissioner Henderson?
I vote yes.
Commissioner Devon?
Yes.
And the chair votes yes. So we now have approved it on the motion on an emergency basis. Do I need to read anything again?
Nope.
Okay, are we good?
You're good. You've got first and second reading and adoption.
Wow. Isabella, thank you so much, though, for all your outstanding work for Deschutes County. And just remember us if you want to come back. If you miss the sunshine, you might want to come back.
We will miss it.
Thank you.
Thank you so much.
you.
Okay, we must be at the Community Development Annual Report.
So if I can ask about the intergovernmental agreement that I stepped out on, is that completed now, or was there?
Dave is working on a little bit of an addition.
Okay.
When I saw the people going door to door on the TV show, on the news, they just didn't look like they were properly attired. I mean, I don't know if somebody's just putting it in something safe, but I just thought they could definitely have looked a lot more professional than they, coming from the experience of being married to a husband and being in a
just more
so he's
medical presence or whatever.
Yes.
Okay.
So Dave's adding a little bit of wording about that.
Nice white jacket and a stethoscope. Do they have to wear a stethoscope?
Well, we're gonna have a thing on their head using a light. So anyway, of course. No, I mean, I just think it's, if they're gonna go door
I
to
know, I
door,
understand
they
what you're
need to
saying,
be
yeah.
looking professional and, I don't know. I'm glad it's in Bend. We'll see how it goes. Okay, sorry, you have the floor now, Nick.
Thank you, Commissioners. Nick Lelak, Deschutes County Community Development Director. First, yes, we will certainly miss Izzy. She's been just a wonderful addition to the department, and we wish her the very best with Multnomah County. We've trained her well as she ventures into her new journey. And I also thank you for your kind comments earlier about my nomination to serve on the Land Conservation and Development Commission. I'm happy to provide an update on that later if you're interested.
Always interested.
Okay, I'll be happy to provide that update. This afternoon, I'm here to present just a high-level overview of the Community Development Department's annual report, which is always for the prior calendar year, and a high-level summary of our work plan for the next fiscal year. Generally, what we'll do is we'll have all of our CDD management team attend your work session in May, and we'll kind of do a round robin and share some highlights from that. But this year, they're online, and they're available by Zoom if you have questions or comments for them. Otherwise, we'll have a bit of an alternative process this year. The purpose of the work session today is to prepare you for the public hearing, which is scheduled for June 10th in a few weeks. Whitney and I have already coordinated on a press release for that so that the public may provide comments in the public hearing that day and or submit written comments prior to that date. And I'll summarize a couple of comments that we've received to this point. One of the things I wasn't planning to cover, but we certainly can answer any questions, are questions about our permit volumes, our performance measures, et cetera. Those are all summarized in the report, and our team is online available to answer questions on those. I'll just hit a couple of our high-level accomplishments from this past year that we're particularly proud of. One is that our lead permit technician, Judy Hackett, was awarded the state's Permit Technician of the Year. That's the second time in about 3 or 4 years that one of our staff members have received that, and it's really a testament to the customer service that our department provides. And Judy has just been exceptional for us for almost 30 years. She's planning to retire next year. She's already shared with us. We completed an active shooter training. We're one of the few departments that have completed that training in very close coordination with the Sheriff's Department, Sheriff Nelson's team. It was really an extraordinary exercise, and I think prepared us well, as disturbing as it can be to go through those practices and those exercises. The board was very involved as we amended the transferable development credit, the pollution reduction credit program, to benefit really the community and the city of La Pine, the neighborhood planning area, and the Russells with moving their project forward in La Pine. That was a big undertaking this past year, and certainly a notable accomplishment. We also participated in a wide range of building code, on-site wastewater rule, and land use regulation committees at the state level to continuously work to make sure that those codes, regulations, and rules work for our county. And so that's always something that we participate in. We summarize those in the work plan's annual report for the last calendar year. Some of the highlights for the work plan projects for the year ahead. Of course, as you can imagine, several of the projects, as we do every year, are to improve our operations. Some things this year, simple cash handling procedures, to continuing to expand our use of technology for permitting processes, public education, public hearings, everything that we're experiencing right now in this room and with the Planning Commission and others. Maintaining high customer service levels, which is always one of our goals, but this year it's really doing that in a new way, practicing social distancing and making sure that we're meeting our customers' needs in these unique times with the pandemic. So we're really committed to continuously making sure that we're meeting their needs. At the same time, and we'll talk more about this next week during your budget hearings, ensuring our department's financial stability and implementing any financial contingency measures that are necessary as economic conditions warrant to make sure that we're financially stable and keeping fees and everything appropriate for staffing levels, but also so that it's affordable for development. A couple of other highlights supporting the road department, and I see that Chris Doty is online here. The road department's effort to lead the Terrebonne wastewater feasibility study. That'll be a big project coming up here this next fiscal year, as well as continuing to coordinate with the city of Bend on their septic to sewer transition. That was in today's bulletin. Certainly something we continue to work on. Supporting opportunities to provide affordable housing, whether it is the pilot projects in Bend or Redmond, or many other initiatives. But of course, one of those that we are undertaking is going to be to work with you on creating and developing a comprehensive Deschutes County housing strategy. We expect to come to the board as early as late next month to talk about a vacant residential lands analysis that we've created internally, and we'd like to summarize that so that we can bring that and begin to discuss that with you and to determine with you how you would like to move forward with a committee of the board or a combination with the Planning Commission or with stakeholders, however you'd like to do that. We'd like to begin to work with you next month on how you'd like to proceed with that project. That'll be very important. Conducting community conversations to consider the Wildfire Mitigation Advisory Committee's recommendations regarding the wildfire hazard map, building a land use code amendments, et cetera. And we're very fortunate that project will be mostly funded by the Department of Land Conservation and Development, DLCD's grant. Similarly, evaluating new state wildlife habitat inventories and conducting community conversations regarding whether any additional protective measures are necessary. And again, that is also mostly paid for by a DLCD grant. Coordinating with cities to update, as they update their comprehensive plans. The city of Redmond is nearly complete with updating their comprehensive plan, a very significant effort over this past year. The city of Sisters is just beginning their process to update their comprehensive plan. Of course, we're continuing to work with the City of Sisters on implementing their vision plan as well. We'll also be working and coordinating closely with the City of Bend as they consider their future growth management plans. They're going to be evaluating whether they should proceed with another urban growth boundary, UGB amendment, or an urban reserve area, creating an urban reserve area for a longer planning horizon, or both, or do they phase one after the other? So we'll be working with them, and I think that'll be a topic of conversation between the Board of Commissioners and the Bend City Council at a future joint meeting. We'll also be working with the City of Lapine to update the master plan for the new neighborhood, the Newberry neighborhood, where the county owns about 320 acres. That'll be a project that we'll also be working on to make sure that the development plan meets the city's needs, meets the county's need as the property owner as we go forward. Our department will also be closely coordinating with Chris Doty and the road department on updating the county's transportation system plan, a big undertaking. One of the changes that we had contemplated earlier this year in January or February was to begin an update of our county comprehensive plan beginning either in late 2020 or early 2021. We now suggest pushing that off about a year, just given all the uncertainties with the pandemic, resources, things of that nature. There's still a lot we can do to prepare for that comprehensive plan update to kick it off, but we suggest let's hold that off for at least 10 to 12 months. There's a lot of other projects that will be more than keeping us fully utilized between then. And of course, the big unknown that we could find out in the next 4 to 6 weeks is whether the legislature amends state law to allow rural accessory dwelling units. And if so, that'll require significant resources, community conversations as well. The Historic Landmarks Commission has reviewed and recommended approval to the board of the work plan. The Planning Commission conducted a public hearing last week, and they recommend a few changes to what you don't see in here. So they'll be in a supplemental memorandum for you and for your consideration. The first is they would like to add a special acknowledgement in the front of the document that the department remained open during the pandemic and continuing to provide quality services to the community. They would like, they're interested in some sort of a work project to add a project or an action item to track economic indicators to track the county's economic recovery. How are we doing? Are we succeeding or not? What is happening? And generally, that's not something CDD does. Generally, that's something that EDCO or the Oregon Employment Department or Central Oregon Visitors Association, but that's something we can certainly be involved in, so we'll figure that piece out if that's of interest to the board.
One of the thoughts there is, to use the state economist and work source people, and because they just got all the numbers, so just figure out a set of numbers you want to understand and then just follow them, because you don't need to run those numbers, but it'd be easy enough to just say, okay, let's follow 6 of the different indicators or whatever it would be.
Yeah, great, thank you. Yeah, and that was our thinking exactly as well, not to recreate the wheel, because other entities and agencies are tracking those very closely. The final one was a suggestion by a member of the public, which is to, and I'll read it as proposed, initiate legislative code amendment to require a review and use of reasonable standards and conditions for establishing short-term rental reasonable standards for short-term rental units in the RR10, the Rural Residential 10 zone. That's not something we've previously regulated. Short-term rentals are those units being rented out for less than 30 consecutive days. The Planning Commission supported that. He was very clear he was not talking about prohibiting them, but rather regulating the use. The parking and other standards is what he was interested in. The Planning Commission supported that proposal, and they also thought that if we initiate such a project, that some sort of a regional variation may be included as well. And particularly, it was Commissioner Swisher from the Sisters area was thinking if we created a regulatory program for short-term rentals, perhaps the Sisters country could be similar to what occurs in the city of Sisters. That was his conceptual thinking in proposing that action item. So that'll be something for you to consider during the public hearing process and deliberation process. The final piece was that while it was not in the Planning Commission's purview, they see that we include in the work plan your annual goals and objectives for this fiscal year, and they suggested while it's not under their purview, they suggested considering amending the economic vitality goal to also address the reopening and reestablishing the county's economy. And I'm sure that's already, of course, on your radar, and you're already doing that, but they really they felt very strongly about that. So the commission was overall very highly complimentary of the document and the projects and everything that we proposed. So that concludes my remarks. I'm happy to answer any of your questions, as well as our team that's available online.
Actually, I know we're not supposed to talk about your budget, but when I was reviewing this last night, I was really pleased to see that your department really made probably a pretty good assessment of what we need to do with next week. So thank you for that.
Thank you.
I appreciate that. And I was noticing on the new single-family dwelling permits that we actually had gone up. It's on page 19. We'd gone up in 2018. They show it as negative, but actually it's a positive number. And then in 19 we actually went down.
You're right.
A couple. So I thought that was really good when I was reading all that, and that was like, great document, a lot of really important information for us. And I know your team has, you honestly remind me of one of my favorite places to shop. You guys do such a good, the customer, you always are so helpful for our community. And, I think that's really critical. And the turnaround, I noticed that one of them was still, you were still like over in the red for the, what is it? Was it like the single family home? Yes, we're still in the red there for some reason. It was in 8 days and we're trying to do it in like 3, I believe. So whatever we can do to help with that, because in this kind of economy, we really do want to make sure that it's as smooth as possible.
And these numbers really reflect 2019. We just met with the building division last week and coordinated services today, and their times are all significantly faster right now, which is really terrific.
Okay.
And land use is also meeting their turnaround timelines as well. Thank you.
Have we already done the marijuana inspections for this year, or are they coming up? Or
good question. That'll be a topic that we can discuss later. Last year we decided to do those later in the year, when the impacts may be better determined to evaluate. And so we have received all of the reports from all of the approved growers, and so we've been planning to do that mid to late summer, and figuring out an alternative rather than having 2 staff go out. Obviously, maybe it's 1, but that is on the horizon coming up later in the summer.
Okay. Yes. And how many reports were there? Do you know how many?
I think Peter Gutowski's online, and he's been tracking this. I think we have 20 that are OLCC licensed and growing today. And I know that the number of approvals has declined, as some have not kept their approvals valid. Some properties have sold, and some new people that have purchased properties with approvals in place have said they don't have an interest in initiating their use for marijuana grows. So I think right now we're holding pretty steady at about 20.
Do you know what our maximum was before?
I think in total the county had approved about 50 applications.
At one point, I think 30 were operational or close to operational or something.
Close to that.
I remember,
yeah, something like that. And I see Peter's zooming in there, so I'm not sure if he has.
Might know some numbers.
Yeah. Good afternoon, commissioners, Madam Chair, members of the commissioners. Peter Gutowski, Deschutes County Planning Manager. We have 21 marijuana production approvals that received an OLCC license. 3, originally we had 24, 3 have subsequently canceled. So again, 21 of 49 approvals that have an OLCC license. Of the 8 marijuana processing applications that have been approved by Deschutes County, 3 have received an OLCC license. One of the 8 that were receiving original approval has been canceled. So we're actively tracking these approvals, and as Nick mentioned, we can certainly coordinate with the board at a later time to determine the best way to conduct inspections. But I think another noteworthy remark is obviously we are currently we currently have a moratorium on any new marijuana applications until the results of the general election in November. But we don't have any pending or active applications that have been tolled or extended. So at this point, as I've summarized, the applications that have been approved are what we have in place, and there's no active file that is consuming staff time or that requires any type of local land use decision.
Thank you, Peter.
And right below that on your list of projects, the non-resource lands, I forget where we are in the process now with those 6 parcels.
If I may, I can address that as well. We are scheduled, Commissioner, to discuss this very issue on June 1st at a work session. As you'll recall, or for those people listening or watching remotely, the board was scheduled to have a hearing on those 6 legacy rural residential areas on April 1st. The timing, of course, didn't correspond with our understanding of COVID-19, and the board unanimously decided to postpone that hearing. And we sent notices. First, we sent notices to all parties that had standing and those that reside in those 6 residential areas of the April 1st hearing. We also followed up with a notice that acknowledged that meeting had been suspended. So on June 1st, we'll engage the commission as staff to get your direction about the appropriate time to reconvene that public hearing at a date that's appropriate for the board.
Thank you.
So a couple thoughts. I want to thank our code enforcement people. It's just one of my bullet items here, but a very dynamic time. We were just racing up to, kind of hyperactivity in the economy, and now stopped dead in our tracks. So switching gears very drastically in the demeanor and what's happening in the community. So as I say, just kind of reaching out and thanking our code enforcement folks. And also the, customer interaction. That is the the customer service, the pride of the whole office and all the folks that work there. So those are some of the basics that are just amazing in our community development department. When I wish I knew the field inspectors better, because when I talk to construction people, they make relationships with all of the inspectors, and you're like, oh yeah, John, and he comes by, and Bill, I'm sorry, I'm just listing off names, but I don't know them, our staff as well, some of the folks, but they've all have a real good reputation out in the field also.
We'll build more houses.
Well, I'd only get to know one inspector. I'm just saying I've heard a lot of these guys' names, and they're well respected out there. Acknowledging this process, though, being able to put a work plan together and having the input from citizens. So we've seen this over the years also. Somebody that just is itching for something to be done. Whatever change it is. This is the input to it. This is the on-ramp. Let's talk about it. Let's talk about it at the Planning Commission. This is your opportunity. If we understand in a public meeting that there's going to be some good of a project, let's put it in the list, and then we'll get to it. So those are all high-level comments, but yeah, very positive. Thank you very much for doing this.
Great article in today's Sisters Nugget about a building inspector working closely with a couple that are building their own home on their property, and what a great relationship they've developed. So it's great to see it reflected in the local media as well.
Oh, great. I'll have reading material tonight. Thank you, Nick.
So yeah, I don't have any other specific feedback at this time. We've been
It's good to see you back. Yeah, we've been thinking about other things besides land use.
Yep.
Usually we see land use the most, but interesting to go through this on the 10th.
Thank you. It's great to be here. It's great to be here in person.
Yeah, there you go, in person.
All of you. I had the pleasure of spending yesterday afternoon with our chair, Adair, in planning commission interviews, but it's great to be back and see everybody in person.
And then a status for
LCDC, I received an email on Monday from the governor's office that I am the nominee for the position. So I guess that means I cleared the background check and other
Well, let's hope so.
whatever they may have done to solidify that position. And then they stated that the Senate confirmation hearing would occur, the email said no less than in 21 days. They suggested that, and of course it's not just me, it's all of the governor's nominees for a variety of boards and commissions, there's 30 to 35, that we reach out to our local legislators to just share with them that we've been nominated and introduce ourselves. So I've sent that email to not just our local legislators, but I did it for all of Eastern Oregon. I went beyond just, given that we have 18 counties and touch 4 states, and I think we're by far the largest and most diverse region of the LCDC region. So I wanted to make sure that everybody knows who I am and a bit of my background. So I just shared that with them earlier today. And so I'll let you know when the confirmation process occurs. LCDC does meet tomorrow. I will just zoom into the meeting from the office, and they've already shared with me that they'll introduce me as a nominee for the position. So it's becoming more public as the time for the Senate confirmation draws near.
Sounds like you should be in D.C.
Deschutes County.
Yeah. I know.
I'm very happy right
Confirmation
here.
hearings.
Well, you said confirmation and the Senate's going to approve you.
Yeah.
And, sounds pretty important, Nick.
Great. Well, congratulations. That's good for all of us. Thank you.
We are so thankful, and you know, I know all the other 17 counties are going to so appreciate your expertise and enthusiasm and what you'll bring to that group. So thanks for stepping up.
Thank you.
Oh, gosh. So now we're at video lottery funding. Thank you, Angie.
Quick rub down.
Mm-hmm.
Chris.
Thank you.
Chris Garcia. Thank you, guys. Okay.
Commissioners, on April 22nd, you began the process of allocating video lottery funds for fiscal year 21. And since that time, and it's noted in the staff report, but we received a payment from the state that was less than we anticipated that it would be. And I apologize to have to do this, but in talking with Greg this afternoon, I think we want to delay this conversation until a future meeting, and so that we can kind of analyze what we know now from the state and what we just get a little bit more information from them about how impacts to video lottery funding may impact next year's allocation. So if you're comfortable, I think we're going to work with Greg offline to get some more information and then come back to you as soon as we're able to have this discussion on next year's allocations. Would that be okay with the board to delay this conversation?
Now that I have my
Now that you have your large version?
yes, now that I have my Swedish flag.
Can we ask a couple questions before you go
Before
away?
I run away, yes, you can.
So, are we not getting the 750 this year? Is that with what we got in this final amount, whatever it was? I can't see it here, but it's somewhere in the papers. Are we not making the 750? I got a reason I'm asking this. With this final 116,970, are we not going to have the 750 this year?
You know, that's part of what we want to touch base with Greg on offline, and I don't want to get out over my skis on that, but that's something that we should come back to you with. I don't think that we're going to be, I think we brought in a little bit more in earlier quarters, so I don't think we're going to be short of that 750, but I want to touch base with him.
Well, where I was going with this is that for this thing we're putting forward for the CARES Act, that spreadsheet, if the state cut our lottery funds based on their ability to do so, which I actually saw in the Constitution last night, I didn't realize they had a constitutional right to cut lottery funds, then would we be able to say that we have a loss because we have made agreements with these people that we would fund them to this level and we don't have those funds this year? And so would that be something we could claim on the CARES Act spreadsheet?
I don't think so. I think they made it clear that we're not allowed to use the CARES money to make up for lost revenue. However, if we earmark some of the distributions to some of our service partners and others based on COVID-related impacts, I think that might be.
Some of the recent emergency grants or grants that we've provided.
Yeah.
Yep.
Yeah, exactly.
And Commissioners, Greg is providing updates. He says CARES does not cover revenue losses, and also that we received $828,000. So above that 750, even with the
828?
Correct.
Well, I wasn't really thinking of losses. I was thinking of our inability to perform a contract to which we're bound. So therefore, we need the money to pay the contract. I was going to leave the loss out of it and say, or like you've really said it, which is we've got an emergency need, which happens to correspond with what we committed or something, or committed plus some. So I guess I'm just, to me, it's a legitimate use. So that's interesting. Okay, so what are we waiting for? We're waiting so that
I think we want to.
what?
We want to tighten up our projection for the beginning net working capital for fiscal year 21. And so we have a meeting scheduled with finance first thing in the morning, and we'll just make sure that that number is as dialed in. Obviously, that's a projection, but is as dialed in as it can be, because I think we just want it to be obviously as accurate as it can be. You'll see we're going to have to make some potential pivots out of the allocations you made in April based on the reduction in what we saw.
Pivots out of. That's good.
Well, it's
We have to reduce some of them.
Whitney, if we're actually going to clean this up.
Yep.
The beginning balance of the year 2020 should be corrected.
Right.
That should be, honestly, if we're going to look at a clean document, that should be done.
We will do that as well.
Okay.
So we're going to have the actual balance, not
Yes.
that had that extra fund, and then for 2021, we're going to have what we
As
really think
tight
we're going
as
to
we
start
can.
July 1st with. Okay.
Yep.
Yeah.
And I know that the board recently added some Monday meeting dates, so I think we should have some, hopefully, like leeway in getting this back to you as soon as we can, and I apologize
Okay,
for.
not next week, but the week after.
Correct.
Good. That would be great because, yeah, if you're going to clean it up, just clean up the whole thing.
Yep.
So that's good.
Now, by looking at this, we can't tell if Central Oregon Council on Aging has been paid their $40,000 or not, right? There's not a column here that really shows
Sort of actual.
who actual payments so far this year. Is that possible to have? Or?
Yeah, we can definitely do that, and we can do that as well.
I'm just wondering, Tom, if that's it might be important to a lot of these groups to get their payments, or they're probably all worried themselves about stuff.
Okay.
Yeah, could you add another column in there for that?
In between for
Yes.
actual to date. Okay.
Yeah, because we've got the budgeted, and then we have actual, and then our projection.
Projections for next year. Yeah.
That'd be great. Okay,
Okay.
thank you,
We'll
Whitney.
talk soon.
So a
Thank
week,
you. Yeah, as soon as
Monday.
we can bring it back. Thank you.
Thank you. Thank you for being so, helping my vision.
Oh, me too. That
I
it's
was
pretty
looking at-
small with the.
Yeah, last night
spreadsheet.
I'm going like, I can't see this. All right, so now we have other items?
So I have a couple. One was on that funding for that relief grant that we're gonna program that we're gonna work through CYC. I really would like to, for us to know or be involved with who's money going to, not just have it all dispersed. And I was kind of surprised when Scott said yesterday that, or maybe it was Monday, that all the loans in that other loan program were sitting on one desk. You know, it sounded like that was being approved by one person or something, and I really think that thought should be given into how we do that. I don't know. I just bring it up as another item.
We can include that in the IGA there. David Gibbons has taken the first stab at that IGA for that particular thing. So I could reach out to David and let him know that we need to put some provision in there for the board, the county to have.
I mean, maybe it's one of us, or maybe
yeah,
whatever. You know, kind of like we spend as much time over $5,000 and $3,000 grants for nonprofits here as we should at least spend for businesses. Why are we doing that business? How many are we getting in La Pine? How many are we getting? You know, a thought process that's more than just, oh, I like this one, I don't like this. You know.
Send him an email right now and let him know we need to include language and work with them on that.
Well, I mean, I think the board made clear that and COIC has acknowledged that you wanted a review committee to look through all these and provide input, which is going to happen. That was acknowledged. So would you like we can either have one of you on that committee if you'd like, or we can bring sort of a proposed set of grants back to the board as a whole to have a look at.
We could look at them, yeah.
Well, I think it'd probably be good if someone was on the committee, honestly. I mean, when you look what happened with the federal government and the fact that they gave what was it, to colleges, and, you know, Harvard has a $41 billion endowment, and they were getting all this money. And then you look at other businesses that got PPNP funding, and they had over 500 employees, and that was clearly the rule of the program. So, you know, we have to do it expediently but correctly.
Yeah, and fairly.
Fairly.
Yeah,
yes, just was talking to someone this morning. There's all those lost personal service people in our community that aren't getting a dime from the state or the federal government. They are in a horrible position, and I said, you know, we have something that's coming up that you definitely would qualify for, and, you know, it's not that much, but at least it would help.
Yeah.
They haven't gotten a dime, and look how long it's gone on now. So it's, you know, it's.
Maybe we can come up with some wording, and then in Monday's meeting we can run over it or something. But I don't want them to get too far down the path with this is how they're going to do it, and because with a couple other things over there, we were kind of not in the planning process. We weren't in the planning process for the Deschutes Basin Committee project, and another one like that. So.
And the housing.
The housing one. So
you don't meet again until a week from Monday.
A week from Monday.
On the 1st.
We're going to meet next Monday because it's a holiday, right?
Well, we'll see each other next week. Maybe we can talk about it at a break or something next week. I think we need to get on it, but
no, and I'm happy to facilitate that however you'd like. I don't know if you want both to have one of you on the review committee plus them all to come back to you, or one of the other. We can draft the IGA either way.
I'd be happy to be on the review committee. I mean, or we could do different sections. Maybe, you know, we could divide it up by areas as far as that goes. I just think it's good to have input, that we try to make sure we can meet our parameters with what we're trying to do with it. So
it's your money that you're putting towards it.
Right.
So right, certainly.
So my email to David Gibbons indicates that the MOU, the review committee must include a county representative, and also that the final approval of awards require Commissioner BOCC approval.
Thank you, Tom.
Is that what you want?
I don't know.
Capture it.
I don't know that we want to stop in a board. I mean, it might take longer if we had to bring it back to a board meeting. So, I mean, I'm supportive of, making sure commissioners involved in the decision process. But, yeah, would we want to do it at this board meeting is my thought process right now.
I don't really want to do the approvals at a board meeting. I just want to make sure we know who's put in for applications.
So participate.
You remember when we did that stiff committee, we really changed who was on it because we wanted some different things than they want. We had a different rationale for who should be on it.
So, yeah, I wouldn't want to bring it back to the board meeting specifically.
So a possible hybrid off of that, besides having a representative on the review committee, would provide that the final approval for the awards would require BOCC chair approval, which could occur outside of a meeting.
That's fine. So it's kind of a report, basically, yeah, and then if there's something that jumps out, you'd have some authority as a chair.
Would that be appropriate?
That would be fine.
There you go.
Another item that came up that I just didn't know, we don't have a way to talk about it without being at a board meeting, was these discussions about the urban renewal district that we're getting from Alan Bruckner. You know, and I guess the city's ready to do this, but I was surprised at the numbers. He sent us a long letter about how much, he sent us, this is his 8th installment of informing us. Alan's been a property owner in Deschutes County for a long time, and he was a mayor of Bend, he was a city councilor in Bend, but I was surprised that what he says we'll be losing is $22 million of tax money, and he makes a pretty good argument for why we shouldn't be supportive of this. It's up to the city to approve it, and he says it's set to be approved tomorrow, or tonight, but I don't know if either of you had thought about this more, about whether I would be on the verge of saying I don't support it. I get what he's saying is that this section over here will probably be possibly developed anyway, and I noticed on our taxes we pay something. Just look this week, we pay something for the Juniper Ridge urban renewal area on our taxes. I mean, I do anyway. I don't know if you. It's like $25 a year for. I don't know what I get out of that, but that's the kind of stuff that it's like, what do we get out of taking this out of our tax base over there? So had either of you given any more thought to that, or did you want to make a position on this issue?
Well, so what's the timing on that? Because we did talk about this months ago.
I don't believe it's the final approval tonight. I got a timeline from Matt Stewart, I think is the project manager there. I think I forwarded it to you all. It was like a month, 6 weeks ago. And they're due to come back to you, I believe, one more time. I want to say the final approval is scheduled sometime in either June or July, but I'll dig that out. I've got it tickled out some point. At one point, it was going to be an item on our joint meeting that we canceled, but so I will confirm that they're to come back to you one more time. That would be a formal opportunity for you to talk about it, register a complaint or an objection or anything else that you'd like. As you know, we've had a couple presentations, and it is a big chunk of money that we would be foregoing across all of our 4 tax districts there. And there was question about, the size. Is the size appropriate? All the different areas that it includes. And the length, 30-year versus 20-year, was also an important moving part in that
So we could
discussion.
give some feedback on those things, yeah.
Exactly.
Because it's, but I think the one thing that, there's been a real emphasis, and this is really a strong emphasis at the City of Bend, of densification and, putting everything up and, making the city look like that. Well, that's just the opposite of what I think works in something like this with the disease. That so it's one more argument to maybe not get it more dense. But I just think the incentive is a big. Do they need the incentive to make all this happen, and will it happen? I'm glad we're going to talk about it again and maybe do some more research on that.
I know, I have been reading his letters, and
He's smart. I mean,
Yes.
I know him pretty well. I mean, he's been around there for over 30 years and maybe
I
40
have
years.
to respect what he's saying.
Cornell graduate.
Okay, Cornell. Okay.
But anyway, maybe it'd be worth having a further discussion with him, even, or in a work session, so we hear a balanced.
Yeah, that would be great to bring you to a work session. Would that be possible?
So I think in the review of this, we can provide input. We don't have authority to stop it. So that was what we had kind of learned about. I would much rather see a 20-year horizon than a 30-year horizon. and the scope of it is large. So, I mean, I think we would all maybe start to move in some direction to be able to put something on paper
Yeah.
as a feedback.
It includes a lot of rental, or it includes a lot of residential area, currently residential.
Yep. And also, I'm involved in the Transportation Steering Committee for the Transportation System Plan, TSP, for the City of Bend as an MPO seat. So I've been invited to that. And part of the calculations for future transportation developments are the things that can get done from this urban renewal, so they don't have to pull it out of other funds. So just saying, there's all roads of Bend, and this is a chunk of it, and the funding are for some of it.
Statutorily, I could tell you that if the first time they were here, it was for informational. The board does have the ability to pass a resolution in opposition to some or all of the plan. That then necessitates the city council formally considering that. They don't have to do anything with it legally, but it would put that issue before them, that the county passed this resolution indicating perhaps not supporting some or all of it, or the scope. So you do have that ability kind of in your toolbox statutorily.
Good. Let's see, another thing I had on my plate was, or a question about, was the presentation we had, Tom, on Monday about the 911 capital plan. Was that just for the purpose of kind of bringing us up to speed, or is it relevant to next week? Or I couldn't really tell why we were doing that then, or.
Yeah, both. So we've initiated some time ago sort of a follow-up. Once the radio project was stabilized, we wanted to investigate where we should invest, ought to invest to enhance coverage, both for in-building and geographic area in the county. And that was sort of one of the main projects of Will Mullins when he was hired as technology manager. So in order to help with that, we hired Trott to do sort of a baseline study of what the coverage is like now. So we got that report back finally, and that was obviously highly technical. So Will, he's working as a consultant for us now, produced a report that summarized that and had a series of recommendations. So number one, we wanted the governing board of 911 to see that first and be able to understand it, digest it, provide input. And then it was presented to the user board yesterday, just similarly for their information and to gain feedback. So there were some price tags attached to the recommendations at the end of that report. So next week you'll look at not only the 911 budget overall for the district, but also its capital plan. So these items are included in the capital plan, and as the governing body, you'll evaluate those and either give your blessing for them to be included in the formal capital budget for 911 for next year, or to request more information, or to kind of leave the appropriation in there, or to defer an actual decision on each of those projects to a later date. So that's all within your decision space for the 911 capital program. So that was just kind of the first step to have a clearer idea of what our options are in terms of enhancing, taking our coverage to the next level, if you will, in terms of both in-building and geographic area, and what it costs.
Thanks. That's all I have.
Okay. Dave, thank you for the article on the churches today from.
It was interesting. LA Times?
Yes, the LA Times, yes. And religious freedom and what has happened to it across our country, honestly. It seems unconstitutional. And I don't know why it's taken quite a while for something to happen, but, and your feedback on the case in Baker that is now going to the Supreme Court, the fact that the arguments can still be submitted Friday to the Supreme Court, And then you think that they may take up to 30 days in order to come up with their decision?
Yeah, that was my best guesstimate. Amy thought it would be quicker. She worked at the Court of Appeals years ago. She seems to think it will be quicker than that in light of the procedural posture of the case. So she thought it could be within 2 weeks.
Okay.
Yeah.
I would think it would be quicker, honestly. Then again, I thought we were going to get our approval on Wednesday, and it came in Wednesday night at 9:23. I think that's when it came in. So, being the optimist. So 2 weeks from Friday then?
Friday, yeah, that was her best guesstimate.
Okay. So the people that are now part of that lawsuit, it seems like it's a pretty wide group.
Yeah, I'm pretty confident it'll be fully briefed, and I don't think there'll be any concern that the issues aren't presented. It's, how the court's going to go with it. 5 of the 7 Supreme Court justices were appointed by the current governor, so
really,
you can read into that what you like on where that might go.
Oh, okay. So what happened in Wisconsin then was, where it was 4-3, their decision. That was the.
Well, they had Scott Walker for governor for 2 sessions. We haven't had. 5 of the 7 have been appointed by this governor, but the other 2 have been appointed by governors just like her. So there's never, for 30 years. So
yes,
that's the simple fact.
1987, right?
Yeah.
So, okay. All right. So, and then if we did get that decision in 2 weeks, then where would it go? If it doesn't, if one of the parties is not happy with the decision, does it go to the Supreme Court?
They could seek review there. It addresses a constitutional issue, whether the U.S. Supreme Court would take it up or not. It's totally discretionary on their part. And I don't know if they're going to weigh in on some of that. It's kind of like the courts kind of stayed out of the way on gay marriage for a long, long time to let it work its way through in the states. And this could be one of those similar things where they don't touch it. Who knows?
Okay. But the DOJ is involved in California, though, according to this.
Yes. Yeah, they would defend that here as well. They are defending the governor here as well.
They're, right.
Well,
it was kind of interesting that the U.S. District Judge was named Jesus, or Jesus, Bernal.
You might take that personal.
I don't know. I was like, well,
that
is very interesting. So.
Well, one reason I think it might go up and they might take it is because, I was reading something about the flu pandemic in 1918-19, and they closed churches then too for a period of time, but I don't think it was more than a couple months. So as this lengthens out, I think there's more and more likelihood the court would take it up, and depending on the number of deaths and stuff, but maybe the governors will, change their rulings by then, and it'll all be moot.
Yes.
It's kind of interesting that way.
Okay.
Commissioners, just follow up on Phil's question earlier about the urban renewal. So tonight, the City Council, acting as the Bend Urban Renewal Agency, will consider a resolution to authorize the draft core area tax increment finance plan and report, which will then be forwarded to each of the applicable taxing districts. So this is kind of the final report on the plan, which will then come to you formally for your consideration. And as Dave mentioned, you can support it, you can register a formal objection, you can make public statements, whatever you'd like to do.
Good. Thank you.
All right. Tony, did you have anything you wanted to?
Just a loose end in preparation for next week budget, just kind of discuss how the room might be set up or how we're going to do business next week, if it's time for that.
I'm in favor of doing it down here and just spreading out, but
I want my own table, 6 feet or
We
8
each have our own table. I mean, we got a lot of tables, don't we? In the other room, we got quite a few.
But I just, yeah, we're all going to be here in person, or we're going to try to do something online. And
I'm all for doing it in person.
Sharon.
I think it's too complicated to do. What's that?
Captain Keith has been working with finance.
Captain.
to set up for-
Oh, Captain Keith. Well, I'm all in favor of doing it in person. We did our interviews yesterday with for the DA's office consultant. It just is so Mike's on that committee, so he, and so we've worked with him, and it's just so hard to know who's going to speak next and when. And I just don't think you have as good of conversations about it. And I think our budget stuff's pretty complicated. And I wouldn't want to sit. I would be doing it at home probably. I wouldn't want to sit at home all day and watching this little screen.
Oh, yeah, well, yeah,
Is
I'm
that
just
what
thinking
you were
logistics. Well, no, I mean, I'm planning on being here.
Okay.
So yeah, just what's.
So, Sharon Keith, BOCC. Anyway, logistics, we are planning to do a design tomorrow to allow for individual tables on the floor, everyone to be able to be captured with camera as well. 6 foot spacing to keep us all safe. And I'm not sure at this point if I need to open up DeArmond as well to spread us all out. But we should be able to get all of the budget committee in here and allow for 1 seat for a department staff person, and then have the remainder of the department zooming in for presentations.
Are you going to make us wear doodle hats?
What's a doodle hat?
That's what they're doing in Germany. You know, the pool doodle things? They have them on their head.
Okay, that's a great idea, Patty.
No, it's for spacing, so we stay in our own proper space.
Oh.
No, I mean, I saw it. I mean, that's what somebody's doing.
I would prefer that you each have a separate color, though.
Okay.
Okay.
So then if we're on a Zoom and we're spread around the room, maybe get a different, one more display. I mean, I'm just thinking, you can probably plug in another TV somewhere if we had to.
Sure.
Just so it's not really wrenching our heads trying to find the corners of the room or something.
I'm trying to read it.
Right.
And we're not on camera, right? It's anybody that wants to zoom in can, or
There'll be some.
No, we'll have the cameras moving
Have that
around.
little printer sound not going all day.
Right.
we don't. In most of our budget meetings, we don't have cameras.
Right,
But
we
this
don't.
is recording.
But because of the fact that we have to maintain that 6 foot distancing, there's no way possible we can do that up in the Allen room. And since we're in here and it's for the public process, we have to provide it for citizen members that want to watch the budget committee versus coming in and trying to.
That's right. Citizens
Right.
allowed.
Yes.
Yeah, it's also to allow the staff to connect with you. So as far as you all, as members of the budget committee, I mean, you probably won't notice the screen so much unless the department's making a remote presentation. So you'll be sitting around in probably an oval, interacting with each other. And the department representative, likely the department director, will be here also, as would Greg and I and Eric and Kathleen and Sharon, and kind of presenting the budget if it's a department hearing. And then if their staff, if they have a sort of a PowerPoint, just like we did upstairs, or if their staff wants to answer a question remotely, they can do that via Zoom. But for you all, it won't really seem that much different than past years, except you're down here instead of upstairs. But we've never filmed them, obviously, upstairs because we're not set up for it. But down here, we will, since we are, and that's obviously the editorial page of the bulletin's been kind of a little bit critical of our public process. So we'll make sure that it's on, that citizens can interact if they want to or watch remotely. And then we'll have Zoom set up for, primarily for department staff to call in and interact with us.
So, and we've always audio recorded the complete sessions year after year, so
Right.
those are available. So it's just adding video this year because of the scenario.
Dave, did you have the document redone then, this intergovernmental document? Do we need to say anything, or you added it and we're fine?
I have the language. I was just waiting. I had pushed it out to Dr. George. He believes OSU has a script for how they greet people at the door, but I do have some language, if you'd like, I could read it to you very quickly.
Sure.
What we would be doing is, if you have your copy there, we would add a section 3.5.1. And we would headline that introduction/greeting. And then it reads, personnel conducting sampling will wear clothing that clearly identifies association with OSU and will greet subjects as follows. And that's where Dr. George was tracking down the script that they've been using.
Okay.
And then proposed section 3.5.2 would be entitled proper PPE. Personnel conducting sampling will be properly outfitted with all necessary PPE as deemed best practice by OSU in consultation with the Deschutes County Local Public Health Administrator. And so those are the two proposals. We can tweak that however you like, or if you're good with that, then
I'm really happy that we added that.
we just plug in whatever that greeting is.
Yeah, from my personal visualization of that story. So to have that, I think that's important. So thank you.
But I don't know.
Well, I just wonder about the first one. Why don't we just say we'll greet them in a reasonable and thoughtful manner according to the script provided by OSU or whatever, rather than him track down the script to put it in our agreement. I mean, that seems like it's really over regulating. Just making sure that.
Okay, so we could say personnel conducting sampling will wear clothing that clearly identifies association with OSU and will greet subjects in a reasonable and thoughtful manner, consistent with greeting script provided by OSU.
I like it.
Does that capture what?
For me. Is that good?
It's fine. I was just worried about what they were wearing.
Let the record show the board advocated wearing OSU.
Okay, well, with those changes,
Could be
if
a hot
it's
topic,
appropriate,
yeah.
we'll make that and tell Dr. George he's okay to sign it then. Is that correct?
Mm-hmm.
Yes.
Okay, thank you.
No, thank you, Dave. Okay, so do we now need to, are we able to, do we need anything else, or can we go into executive session?
I don't have anything else.
Okay.
Take a quick break.
Okay, we're going to take a quick break. Okay, so should we just actually